Order, the clerk will now proceed to read the title of the private bill set down for today.
Royal Albert Hall Bill, Lords, second reading.
Second reading what day?
Tuesday the 24th of June, Mr Speaker.
Tuesday the 22nd of June, was it?
24th.
24th of June. Marvellous, thank you, Hank. Right, we now come to questions. Secretary of State for Health and Social Care, Helen Maguire.
Question number 1, Mr Speaker.
Secretary of State.
Thank you, Mr Speaker. And the member for West Lancashire sends her apologies due to a family issue, and she's very much in our thoughts today. With permission, Mr Speaker, I will take questions 1 and 15 together. Thanks to the decisions taken by my right honourable friend the Chancellor at the spending review, health capital budgets will increase to £14.6 billion by the end of the spending review period. This will deliver the largest ever health capital budget in NHS history. Across this settlement, over £5 billion will be invested to address the most critical building repairs, reducing the most serious and critical infrastructure risks, rebuilding the broken NHS left by the party opposite.
Helen Maguire.
Thank you, Mr Speaker. Whilst I welcome the recent announcement of £12 million of extra funding for Epsom and St Helier Hospital, this is quite frankly a drop in the ocean in comparison to the scale of need, because the current backlog at Epsom and St Helier is £150 million. Patients and staff deserve safe and modern facilities and not patchwork repairs. So can I therefore ask my right honourable friend, the Secretary of State, to meet with me and visit Epsom and St Helier Hospital to see firsthand the scale of the challenge and to see how we can accelerate progress?
I'm grateful to the honourable member for her question, and I absolutely appreciate the challenges she describes, having met myself with the Trust, and I know my honourable friend and I, the Minister for Health, have both met local MPs about the challenges facing Epsom and St Helier. Lord Darcy's investigation found the Conservatives left a £37 billion black hole in NHS capital. We're reversing this trend with the largest ever capital budget for health. The £12.1 million for Epsom and St Helier Trust for estate safety is in addition to the £207 million of capital that the South West London ICB is receiving, including for maintenance backlogs. It will take time, but brick by brick, Labour is rebuilding our NHS.
Joe Paul.
Thank you, Mr Speaker. The Imperial College NHS Trust has the largest high-risk repair backlog in the country, so the support from the Government Estate Fund is very welcome. But to solve this problem, we ultimately need a new St Mary's. So would the Secretary of State join me in praising the work of the new 3-year St Mary's Task Force, which aims to get to full planning consent and explore different financing models so we can finally get this hospital built?
Mr Speaker, can I firstly thank my honourable friend for the work that he and our honourable friend, the member for the Cities of London and Westminster, are leading in partnership with the Trust and Westminster City Council to ensure the people of his constituency have the hospital they deserve. As he knows, this will be the most complicated scheme in the new hospital programme, but that is no excuse for the years of delay this scheme has faced, and the Trust now boasts the biggest high-risk repair backlog in the country. So he is right to make sure that this is not allowed to be put into the too difficult pile again. We look forward to engaging constructively and doing everything we can to expedite progress that's desperately needed for his community and our city.
Caroline Bourne.
Thank you, Mr Speaker. I recently visited Modbury Pharmacy, where owner Phil Dawes highlighted the challenge... Question number 2. Excuse me.
Minister.
Thank you. With your permission, Mr Speaker, I'd like to take question 2 and 10 together. After years of underfunding, the Government agreed a record uplift of £3.1 billion for 25-26 for the pharmacy sector. The Pharmacy Access Scheme provides £19 million to support pharmacies in areas with fewer pharmacies, including in rural areas, but funding must always come with reform. And our hub and spoke legislation, which if passed in the other place today, will allow pharmacies to streamline their dispensing processes, is a major step in the right direction in terms of the reform that must always be married with investment.
Caroline Bourne.
Thank you, Mr Speaker. I'll start again. I recently visited Modbury Pharmacy, where owner Phil Dawes highlighted the challenges facing small rural pharmacies, and he explained how the current funding model doesn't take into account the lower footfall and the limited referral rates that are common in rural areas. Now, we know if a pharmacy in a small market town closes, it can cause extreme difficulties for people to access advice and medicines, particularly where there is little or no public transport and they have to go a long way. So I'd like to ask the Secretary of State whether the government will consider introducing rural exceptions or adjusted funding thresholds so that we can keep community pharmacies open.
Well, I thank her for that question, and the pharmacy sector is facing huge challenges after massive cuts over the last 14 years. We're beginning to rebuild, but she's right that there are particular challenges for rural pharmacies. We are looking at comprehensive reform in the pharmacy sector around better use of technology, hub and spoke dispensing, and a range of other options which would enable better remote dispensing for rural pharmacies.
Okay.
Thank you, Mr. Speaker. I've visited pharmacies across my constituency and they're all struggling to provide a service, but they're all very keen to take on the new services that the NHS is suggesting. Will the Minister commit to ensuring that rural and community pharmacies are properly staffed and equipped to deliver those community services such as diabetes testing and weight management treatments, so that patients aren't left behind just because of where they live?
Well, I thank her for that, and she's right that pharmacies are going to play a really central role in the shift from hospital to community that we'll be putting at the heart of our 10-year plan. As an important part of that is, of course, Pharmacy First. The take-up of Pharmacy First is not where we would like it to be. We are looking at options to increase awareness of Pharmacy First and also to free pharmacists up so that they can operate at the top of their licence. Part of that is about streamlining the dispensing side of what they do, and the hub and spoke legislation that I mentioned earlier is going to be really important in that context.
Steve Yam.
Thank you, Mr. Speaker. The Minister has spoken many times before about the importance of shifting from hospital to the community. I've visited many local pharmacies and met with the Chair of Community Pharmacy Nottinghamshire, seeing firsthand the important work that they do supporting communities in Mansfield. As such, I wonder if he agrees with me that community pharmacies have a key role to play in this shift and could help take pressure off GP surgeries.
Well, he's absolutely right, and I commend him for the work that he's doing in his constituency and with pharmacies in his constituency. What we want to see in many ways is a culture change, because the interface between general practice and community pharmacy is not where it should be. We believe that pharmacists have a huge amount more to offer, but that requires a better digital interface and also better information sharing and a single patient record, and that sort of vehicle will be really important for delivering some of those reforms.
Shadow Minister Luke Evans.
I'm pleased to hear the Minister speak of pharmacy first, something that was brought forward by the last government, welcomed by the communities, the public and the pharmacists themselves. So under this government, I'm pleased to see it continue. Could I ask, though, why has the government decided to cap the number of consultations a pharmacist may do?
Well, of course, part of this is the financial arrangements for Pharmacy First. Those need to be placed at a level which incentivise pharmacists to do Pharmacy First. Sadly, the way in which it was set up under the previous government, those incentives weren't working, and that's one of the reasons why take-up of Pharmacy First hasn't been where it needs to be. So it's not really a question of capping, it's much more a question of getting the level of financial compensation right for Pharmacy First so that it works and it incentivises the system.
Evans.
I'm grateful to the Minister for his answer. Part of the problem, though, is once they hit that cap, they are no longer paid the £17 per consultation. So that, in turn, may mean patients will either be turned away or the pharmacist has to take the hit and has to pay for it themselves. This disjoins the system and actually could create extra costs, because patients who are turned away will turn up in other areas of primary care, such as their GPs. How does that fit with Darzy's push towards community-based services?
Well, he will have seen, and I'm sure he will welcome, the record uplift of £3.1 billion that we're putting into the pharmacy sector after years of underfunding, incompetence and neglect from the benches opposite. A big part of this is about ensuring that shift from hospital to community, and we want pharmacists to be taking pressure off primary care. We've got to make pharmacy first work effectively. That means getting the allocation of funding right. That is what we're working on in terms of reforms. Now we have the spending review and the package going forward. That is what we will be delivering.
Thank you, Mr. Speaker. Question number 3, please.
Minister.
Thank you, Mr. Speaker. Increasing the resilience of the UK medical supply chain is a key priority, and I meet with the team very regularly to routinely take action to mitigate supply issues, including requesting additional stock, identifying alternative global sources and issuing management advice. While the Department has no plans to conduct a specific review, we constantly work to identify and take forward further actions to reduce the impact of medicine shortages, including targeted winter monitoring.
Thank you, Mr. Speaker. Having worked in community pharmacies for nearly 20 years, I have witnessed the pain medicine shortages can cause for North Somerset patients and their loved ones firsthand. Will the Minister meet with me, my friend the member for Exeter and other members of the all-party parliamentary group for pharmacy to discuss the outcome of our inquiry into medicine shortages?
Well, I'd like to thank my honourable friend and constituency neighbour for his dedicated career in community pharmacy and the expertise that he's bringing to the work of the APPG to understand the impact on patients and pharmacies of this issue. I am planning to hold a parliamentary event on this issue later in the autumn, Mr. Speaker. I'm keen to work with the APPG on making that a success for all members.
Richard Tolman.
Thank you very much indeed, Mr. Speaker. Supply chain issues are just one of the many impacts that community pharmacies are facing at the moment. My local pharmacy in Noak Bridge is also facing these supply chain issues, but it's also now been hammered with national insurance increases, which mean that its long-term viability is really at stake when all of these issues are taken together. So could the review that the Minister is looking at actually include all impacts on community pharmacies, which are actually impacting their long-term viability?
Thank you, Mr. Speaker. Well, the long-term viability of pharmacies, indeed the whole NHS, was under threat from him, his party opposite. Thanks to this government, it is being made fit for the future. This is a serious issue for all our constituents. We want to make it work better, and he will see from the 10-year plan that we will make the NHS fit for his constituents, mine and everybody else's in this country.
Liberal Democrat spokesperson Alan Morgan.
Thank you very much, Mr. Speaker. Community pharmacies in North Shropshire and indeed across the country are struggling not only with supply chain problems, but also dispensing some of the medicines that are so critical for our constituents at a loss. So I was particularly concerned to read that higher prices for US pharmaceuticals are on the table for the next stage of trade negotiations with Donald Trump, because an additional £1.5 billion would cost both the NHS and our community pharmacies dear. So can the Minister outline the steps the Department is taking to ensure that the NHS and the vital medicine supply that we rely on are not used as a bargaining chip in a trade deal with a highly unreliable US president?
The Honourable Lady raised an important question about the pharmaceutical industry, which is absolutely key to this country's growth mission and support in all our constituents and in the entire country. As we know, my friend, the Right Honourable Member of the Prime Minister, is obviously at the G7 at the moment. We have good relationships with America, and of course the Department is working very closely across government to make sure that the sustainability of supply is absolutely there for our constituents.
Lushabakar.
Mr. Speaker.
Thank you, Mr. Speaker. With permission, I'll take questions 4 and 9 together. The government inherited a ludicrous situation where patients couldn't get a GP appointment and GPs couldn't get a job. So one of my first acts was to cut red tape to give practices flexibility to hire GPs, along with an extra £82 million investment. Thanks to that combination of investment and reform, this government has recruited an additional 1,700 GPs to the front line since July, exceeding our target of 1,000. We've invested an extra £889 million into general practice this year, taking action to bring back the family doctor. We don't pretend to have solved all the problems, but change has begun and the best is still to come.
Thank you, Mr. Speaker, and I welcome the government's commitment to restoring the family doctor and the recruitment of 1,700 additional GPs nationwide. However, my constituency of Gillingham and Rainham has yet to benefit from this. Concerns have been raised with me about the expansion of the additional roles reimbursement scheme to include only newly qualified GPs. It may be too restrictive. Having met with local GP partners who share this concern, will the Minister meet with us to discuss how the scheme can better support areas like mine?
I'm very grateful to my honourable friend for her question. We are investing an extra £900 million into general practice, reforming the GP contract to help bring back the family doctor and end the 8 a.m. scramble. That contract reform included further changes to make it easier to recruit GPs through the scheme. She will see when we publish the 10-year plan for health shortly that general practice is at the heart of our proposals to build a neighbourhood health service, and I'm keen to work with her and GPs to make it further easier to make sure that qualified GPs can get jobs and patients can get a GP appointment. I'd be delighted to meet her.
Luke Murphy.
Thank you, Mr. Speaker. After 14 years of the Conservatives running down the front line of the NHS, many people in Basingstoke still struggle with access to their GP. One of the issues raised time and time again by patients and GPs is the lack of investment, capital investment in new provision to meet growing housing needs. Chinham Medical Practice, for example, was built to serve just 8,000 patients, now serves over 18,000 and is set to serve many thousands more in the years to come. So can the Secretary of State set out what more the government is doing so that every patient in Basingstoke can see their GP when they need to?
Thank you, Mr. Speaker. My honourable friend is absolutely right. And just as this government is delivering record home building with a huge target to build the homes that Britain needs, we also need to make sure they get the local services that they deserve too. That's exactly why this government has invested an extra £102 million this year to create additional clinical space within over 1,000 GP practices, which will create new consultation rooms and make better use of existing space to deliver more appointments. I know that Chinham Medical Practice was one of the practices put forward by its ICB for funding, so I hope that we'll see that practice benefiting from this investment in the near future as we rebuild our NHS.
Clive Jones.
Mr. Speaker, the government's additional roles reimbursement scheme led to just 3 new GPs for my constituents in Wokingham. It's a drop in the ocean. More needs to be done to deliver GP practices to new developments like Arborfield and South Wokingham. Why didn't ministers support the Liberal Democrat amendment to the Planning and Infrastructure Bill, which would have ensured that commitments to build GP surgeries in all new housing developments were made legally binding?
Mr. Speaker, probably because being that prescriptive about every housing development was probably not sensible, even if the thrust of what he's describing is absolutely the right approach, which is as new housing development is built, we need to make sure the local infrastructure goes alongside it. I take what he says about the numbers of GPs, and as I said, we don't pretend to have fixed all of the problems in 11 months. With respect, those are 3 more GPs than were there before. I know there's more to do. Give me time. We will rebuild general practice for his constituents and everyone else's.
Yes, Bramford.
Access to GPs in my constituency of Chichester is being undermined by the closure of the Westbourne branch of Emsworth Medical Practice at the end of this month. Patients now have to travel to Emsworth, but this is a small rural village that I'm talking about, and there is no public transport to get my elderly and my vulnerable patients to that medical practice over the border. Will the Secretary of State please meet with me to urgently discuss how we can protect this vital service in a rural village in Chichester?
I can well understand the honourable member's concern and her constituents' concern. Practice closures are hard on communities wherever they are, but they hit disproportionately on rural communities and those that suffer with poor transport connectivity. I'd urge her in the first instance to raise the specific local issues with the ICB, but can I reassure her and other honourable and right honourable members that the needs of rural, coastal, remote communities are very much in our mind and thinking, and crucially in the 10-year plan when thinking about how we build genuine neighbourhood health services in all types of neighbourhoods.
Tim Farrell.
Question number 5, sir.
Minister.
Thank you. I know that this is an important issue for the honourable member from the meeting that we had about this last year. This government is supporting local providers by recruiting an additional 8,500 mental health workers by the end of this Parliament. We're also expanding NHS talking therapies and piloting 6 new 24/7 neighbourhood mental health centres, including Hope Haven, serving Whitehaven and rural Copeland.
Tim Farron.
Thank you, Mr. Speaker. I thank the Minister for his reply. But this month, the CQC found high levels of staff vacancies in the already understaffed psychiatric intensive care units and acute mental health wards in South Cumbria, concluding, and I quote, "This is putting patient safety at risk." And yet, worryingly, the ICB in South Cumbria are making 142 million in additional cuts this year, with North Cumbria making cuts also. So in the light of this, what is his plan to intervene and ensure that mental health staffing in Cumbria is increased to safe levels?
I thank him for that, and there's no doubt that the NHS and universities and others need to do more to get students, trainees and qualified doctors and mental health specialists in places where the NHS and patients need them. We will publish a refreshed workforce plan later this year to ensure the NHS has the right people in the right places to care for patients when they need it.
Thank you, Mr. Speaker. The SNP has cut mental health services across Scotland while failing to recruit the necessary workforce in rural communities like those in Stirling and Strathallan. What assessment has the Department made of how devolved mismanagement of mental health services is affecting outcomes for patients in rural Scotland?
Well, I thank him. If we were to make an assessment of the way in which the SNP has mismanaged its responsibilities in Scotland, we'd be here for a very long time. So I'm not sure I can answer. Not sure I can answer his question in the round, but I am sure that colleagues from the SNP will be welcoming the record investment that the UK government has made in Scotland, and I'm certainly looking forward to the improved results they'll be delivering as a result.
Number 6, Mr. Speaker.
Minister.
Thank you. The spending review announced increases in NHS spending alongside more money for adult social care. By investing in DEXA scanners, we can more rapidly treat conditions like osteoporosis, which particularly affect elderly women. Our urgent and emergency care plan promotes falls prevention technology for longer independent living and fewer hospital admissions. And GPs are now incentivised to improve continuity of care, benefiting patients with long-term conditions.
I thank the Minister for his reply, but as the Secretary of State knows only too well, my borough of Havering contains one of the highest numbers of elderly people in the entire London region, yet Queen's Hospital in Romford remains chronically underfunded, overstretched and struggling to meet the growing healthcare needs of an ageing community. So, will the Minister commit today to the serious investment that Queen's Hospital so desperately requires to ensure better health outcomes for older people across Romford?
Well, I thank him for that question, and I carefully note the fact that my right honourable gentleman, the friend who's sitting next to me, has got an interest in this issue, so I'm going to tread very carefully in my answer. I do understand that the honourable gentleman has discussed this matter with my colleague, the Minister of State for Health. The North East London Health and Care Partnership ICB is responsible for delivery, implementation and funding decisions for local services, but his representations, I know, have been very carefully noted today, not least by my right honourable friend, the Secretary of State for Health.
Thank you very much indeed, Mr. Speaker. One of the most important things we can do to support the health of the elderly is to ensure they're able to get to see their local doctor. And it's great to hear the Health Secretary talk about the improved access to appointments. We're seeing that in Chesterfield, but he's also right to say it is literally the first step back up the mountain. This government has inherited a real crisis in general practice access, and it's particularly difficult in the more deprived areas. So can my honourable friend tell me what more we're going to do to ensure that people are able to get to see a GP, and particularly that those practices that serve the most deprived communities are able to get access to the extra GPs that they need?
Well, I thank him for that question. He will know that when we came into government, we inherited the absurd situation where the additional roles reimbursement scheme was weighed down by red tape, and it wasn't actually possible to recruit GPs. We changed that. We invested 82 million extra, and as a result, we have well over 1,000 more GPs on the front line. But that is just the beginning. We've got a contract reform, £889 million for additional investment in general practice. We're moving forward with online booking system, obligatory by the 1st of October. We have got much more work to do around in the interface, for example, with pharmacy, and we're working hard on that. So there's a lot more to do, but my honourable friend is right that the first step up the mountain has been taken.
Shadow Minister, Dr Caroline Johnson.
Thank you, Madam Deputy Speaker. Sorry, Mr Speaker. Get in trouble now. Mr Speaker. Mr Speaker. Last time we came to... Sorry, I'm not getting called now, am I? Mr Speaker. Last time we came for questions, I asked about delays to crucial medications in A&E, and the Secretary of State said he was interested to hear more. But his officer said he would delegate it to his minister, and we still haven't been offered a date. So if I could encourage him to look into that, please. The U-turn on winter fuel will help the elderly stay warm and healthy this winter. But another way to help elderly people will be to protect them from respiratory syncytial virus. Will the government extend the vaccination to the over 80s?
I thank her for that question. I didn't quite catch the word that she used. The virus was called? Oh, on RSV, sorry, yes. Well, we are certainly looking at increasing the coverage of the RSV vaccination. I don't have the statistics to hand at the moment. I'd be happy to write to her on that point.
Dr Johnson.
Mr Speaker. Many of those on waiting lists are elderly and have chronic conditions, and rather than see consultants at regular intervals, which may coincide with them being relatively well, they're often kept on open appointments they can call when they're ill. This is efficient and responsive care. Is the Minister aware this is being stopped in some areas to improve figures? I'd like to quote him from a letter sent to a elderly patient. I regret I cannot keep him on my waiting list under the open appointment for treatment. I have explained the politics of everything and where we are at. Being re-referred to a GP each time is inexpensive and a waste of time. Can the Minister explain why doctors are being asked to make decisions for political reasons and not clinical ones?
I don't think any decisions are being made for political reasons. Our medical and health staff are focused very much on doing the right thing from a clinical point of view. She raises an important point around continuity of care, people constantly having to be re-referred into the system. Part of the reason for that is the utter incompetence with which the previous governments managed our primary care system, and so we've ended up with people being passed from pillar to post. The additional roles reimbursement scheme, not actually about having GPs on the front line, but having other staff and people, so there's more friction in the system, poorer continuity of care. This government is going to bring back the family doctor. That is the way to get our general practice back on its feet.
Art Ferguson.
Apologies, Mr Speaker. Number 7.
Thursday.
Thank you, Mr Speaker. With permission, I'll take questions 7 and 16 together. This government is delivering record investment in our NHS, but that investment is drawn from taxpayers, and we have a responsibility to every taxpayer in the land, as well as to patients, to make sure that every single penny is well spent. And that is why that investment is matched with bold reforms so that we get value for every penny we can. The abolition of NHS England will slash duplication and unnecessary bureaucracy. And I'm pleased to report to the House that we have slashed spending on agency staff by almost £1 billion compared to last year. And all of those savings are being reinvested into frontline care.
Thank you, Mr Speaker. I know from speaking to my local NHS trust in Gateshead the value they place on driving costs down, but they still face financial pressures. Key amongst those is related to the digital capital gap. We are really keen in Gateshead to get that down and allow more people to make remote access to the NHS. So will he meet with me and Gateshead NHS Trust to talk about how we can tackle that?
Thank you, Mr Speaker. I'd be delighted to, and he's absolutely right that we've got to make sure the NHS isn't just benefiting from, but is at the forefront of the revolution taking place in digital services and medical technology. It's key to driving productivity and financial sustainability. And that's why at the spending review, the Chancellor announced we'd invest up to £10 billion in NHS technology and digital transformation. Unlike our predecessors, we won't raid tech budgets to plug shortfalls in day-to-day spending. And just this month, we announced modernisation of the NHS app so patients can receive test results and book appointments, saving £200 million in stamps, envelopes and letters.
Lynn Jones.
Thank you very much, Mr Speaker. I thank the Secretary of State for his reply. Now, in Scotland, there are more quangos than MSPs, and after 4 years and £30 million of taxpayers' cash down the drain, the SNP scrapped its plans for a national care service. And their flagship policy, which was seen as a significant setback for Scottish social care reform, and then we have people going to the pub in chauffeur-driven ministerial cars. Now, I wondered if my right honourable friend could give advice to his Scottish counterpart on how to stop wasting Scottish taxpayers' money.
Well, given the state of the NHS in Scotland, I suspect my counterpart needed to go and drown his sorrows. But the truth is that the longer the SNP are in government, the longer the NHS in Scotland is on the road to nowhere. They're now on their 5th health plan in 4 years. Now, thanks to the decisions taken by the Chancellor, it's not just the NHS in England that's receiving record investment, it's the Scottish Government too. I've used that investment to cut waiting lists by almost 250,000. The same could be true in Scotland if the Scottish people boot out the SNP and elect Anna Sarwar and Jackie Bailey to deliver the change that Scotland's NHS needs.
Thank you, Mr. Speaker. A good way to save money in the NHS is to invest in palliative care and end-of-life care, because it averts costs that would otherwise go into the acute sector and into ambulances. But this government is taking money from that sector through its national insurance rises. So given that the ICBs are supposed to commission palliative care, can the Secretary of State commit in the 10-year health plan to a proper revenue funding model for hospices and also for a minimum service specification for palliative care?
Mr. Speaker, I can reassure the honourable member that end-of-life care is featured in the 10-year plan for health. And I also recognise the pressure on our hospice sector, which is why this government, as well as delivering £26 million through the Children's Hospice Grant, also committed £100 million of capital investment, the biggest in a generation for our hospices. But hospices do rely on the generosity of donors, and I'm keen to work with the sector to look at what more we can do to encourage investment working in partnership. The final thing I would just say is that the parties opposite, they welcome the investment in the National Health Service whilst opposing the means of raising it. And they can't have it both ways. Either they support the investment and the revenue raisers, or they've got to be honest with the public that they would be cutting the NHS.
Chairman Logan.
One of the most egregious examples of waste in recent years was the almost £10 billion spent on useless PPE during the pandemic. So when the Treasury eventually recovers some of this money, can the Secretary of State assure me that Scottish taxpayers will benefit in the usual way through the usual channels?
Of course, Mr. Speaker, fiscal decisions and spending is a matter for my right honourable friend, the Chancellor. But let me reassure the honourable gentleman of two things. Firstly, the way in which the taxpayers of this country were ripped off during a national emergency was a total disgrace, and this government is determined to get our money back and reinvest it into frontline services where it should always have been. The second thing I can reassure him is that so long as there is a Labour government here in Westminster, Scotland will continue to benefit from the investment it needs to sort out its public services. Now it just needs a Labour government in Scotland to spend that money wisely.
James Usser.
Number 8, please, Mr. Speaker.
So state.
Thank you, Mr. Speaker. This government is committed to fixing the NHS and reducing A&E waiting times. Our new urgent and emergency care plan is backed by nearly £400 million worth of investment to deliver new urgent treatment centres, mental health assessment centres and almost 400 new ambulances. Alongside that investment, we're reforming urgent and emergency care so more patients are treated at the scene or in their homes where appropriate, which is better for them and will help unclog accident and emergency departments. Lots done, much more to do.
James Usher.
Thank you, Mr. Speaker. The Minister of State recently visited my constituency and saw the pressures Newham General A&E was under, which is partly due to the pressures we've had left from the last government, but also through capacity issues through a massive growth in population in the borough, and further pressures will come as we regenerate the massive areas of brownfield site in the Royal Docks. So can I ask the Secretary of State to reassure my constituents, as well as the excellent work being done on data-to-rate capacity, we will be looking at infrastructure over the longer term to make sure we're dealing with not only the growth we've had, but future-proofing at the population growth to come.
Thank you, Mr. Speaker. I know my honourable friend enjoyed her visit, and can I thank the staff at Newham Hospital for the work they do, which also benefits my constituents. And of course, we need to make sure that we're supporting hospitals across our country to meet need. We are part of a wider ecosystem, and those points are also powerfully made by the honourable member for Romford, I noticed as well, and in his earlier question. But back to my honourable friend's question, he's right to raise increasing demand and pressures, which is why we'll shortly publish our 10-year plan for health, and I'm happy to report Whipps Cross and Newham hospitals have also been provisionally allocated £28 million this year to improve buildings and estates.
Thank you, Mr. Speaker. The government continues to claim that it wishes to expand community diagnostic centres to speed up scanning and treatment of patients and therefore reduce demand on the likes of A&E. So I asked the Secretary of State, why is the government therefore cutting the revenue tariffs that are available to CDCs under the previous Conservative government, which is already impacting the financial viability of the CDCs and access for patients?
Mr. Speaker, I think the honourable gentleman will find that since this government came to power, we've reduced NHS waiting list size by 250,000. NHS waiting lists are coming down. For the latest figures that were published, it's the first time since April, it's the first time in 17 years that waiting lists have fallen in the month of April. So we are making progress, not least thanks to the investment we're putting into community diagnostic centres. And I do think the honourable gentleman has some brass neck to complain about NHS services under this government when we're cleaning up the mess that they left behind.
I could also help by extending the hours at Chorley A&E. Olivia Blake.
Number 11, Mr. Speaker.
Minister.
Thank you, Mr. Speaker. The 2010 Sunbeds Act banned the use of commercial sunbeds for under 18s, requiring businesses to prevent underage use. And the Department has commissioned the Committee on Medical Aspects of Radiation in the Environment to review the Act, including the effectiveness of the under 18 ban.
Olivia Blake.
I thank the Minister for that answer. According to Cancer Research UK, 86% of melanoma skin cancer cases are preventable. My constituent Charlotte, who has stage 4 melanoma, alongside Melanoma Focus, is leading a campaign to get better enforcement for the ban of sunbeds by under 18s and also to stop the use of harmful melanotam 2 products such as tanning nasal sprays and injections. For under 35s, just one session on a sunbed is enough UV exposure to increase the risk of melanoma to 59%. Prevention is better than a cure. Will the Minister meet with us to discuss the effectiveness of this ban and preventative measures such as access to free sunscreen at events?
Mr. Speaker, and as someone who's diagnosed myself with an earlier stage melanoma, I really commend her constituents' work, and I never used sunbeds, and I spent my youth in Ireland holidays, so I never saw much sun either. Sorry to the Irish Tourism Board. This is, as she says, an overwhelmingly preventable cancer. Sunscreen, better clothing, shading, no sunbeds. It is up to event organisers to support particularly sunscreen at those sorts of events. She's absolutely right, and I personally thank Melanoma Focus for the support that they gave me during my diagnosis. There's great charities out there to support, and I'm sure my Minister will be in contact with her and a constituent to highlight the prevention aspects of this disease soon.
Cameron Thomas.
Speaker, until his recent death, my constituent Luke Webster had lived with alternating hemiplegia of childhood. His life was short and he spent much of it being moved between different care facilities to the frustration of his family. At one such facility, Luke was abused. Will the Minister meet with me and Luke's mother to discuss improved safeguards for those living with neurological conditions?
To suntan and the sun. I think we'll move on. OK. Let's move to Mike Martin.
Thank you, Mr. Speaker. Question number 12.
Minister.
Thank you, Mr. Speaker. More patients are now getting world testing technology in the NHS as part of our mission to revolutionise cancer care in this country. This government is spending £600 million a year in capital on diagnostics, including funding for the first time automation of histopathology laboratories to improve productivity. We're also funding pathology networks to reach digital maturity by 2026, which will reduce unnecessary waits and repeated tests.
Martin.
Thank you, Mr. Speaker. I thank the Minister for her response. Julian, one of my constituents, noticed that he had a mole that was growing and bleeding on his chest. Members of his family had died from skin cancer, so he was very concerned and went to his GP, referred to the Kent Integrated Dermatology Service. He was told the results would come back in 4 weeks. They actually came back in 17 weeks. I know that this is of personal concern to the Minister. Would she investigate what happened and write to me, please?
Well, he raises an awful case, and he's done that well on behalf of his constituent. And of course, our targeting of waiting lists include diagnostics. That shouldn't happen anyway. And of course, I'll make sure that you get a response on that as soon as possible.
B.O. Oliver.
Question number 13, Mr. Speaker.
Minister.
Thank you, Mr. Speaker. With permission, I will take 13 and 20 together. Reducing waiting times for cancer diagnosis remains a key priority, and under this government, an extra 99,000 patients have had cancer diagnosed or ruled out. This has been supported by investment, including Cancer 360, a digital innovation that brings patient data into one central platform, and NHS England's Cancer Open Innovation Call to fast-track cutting-edge interventions into practice. Our forthcoming National Cancer Plan will set out how we will speed up cancer diagnosis even further.
I thank the Minister for the answer. Our Labour government has recently invested in a new state-of-the-art Linex machine in Southend Hospital. The machine is the first of its type in the country and will drastically improve cancer treatments. Please, can the Minister outline how record levels of investment, like the Linex machine, and at the spending review, will finally mean that the NHS will be there when we need it?
I am delighted that his constituents will benefit from that £70 million investment. These machines are game-changing. They reduce the number of visits for his constituents. They are more reliable. That gives more capacity to the system, so that's better for staff, less cancellation of appointments. That's exactly the sort of thing we want to see more of and that we are delivering under this government. The result of our drive to reduce long waits and treat more people more quickly. We had that reinforced in the last spending review, and that is exactly what his constituents deserve.
Thank you, Mr. Speaker. Early diagnosis of less survivable cancers is vital if survival rates are to improve. What assessment has the Minister's Department made following the publication of the APPG's Less Survivable Cancers report, looking at earlier detection and faster diagnosis? Also, what steps is the department taking to deliver this? Thank you.
Well, she is absolutely right to highlight that issue, and can I commend her work not just on the APPG, Mr. Speaker, but also her leading now the Select Committee on behalf of her honourable member, the chair of the Select Committee. Is doing great work, and she's also right to highlight again it's a priority for the government to diagnose cancers earlier and improve survival rate. Really important for this particular group with rare cancers. The APPG's report will inform the development of our National Cancer Plan, which will seek to improve all aspects of care throughout the entirety of the cancer pathway.
Alison Bennett.
Thank you, Mr. Speaker. Part of a successful cancer journey is, of course, having swift cancer treatment as well as swift diagnosis. My constituent Catherine was diagnosed last year with stage 3 breast cancer. She had a mastectomy and went through chemotherapy. She was then meant to begin a course of radiotherapy in December. As of May, that still hadn't begun. What can the department do to ensure these unacceptable delays don't happen and lives can be saved?
Well, again, as so many honourable members across the House rightly highlight the actual experience of people throughout the entire pathway. We've already heard about the investment that we are making in machines and also in staff to make sure that people don't just get that fast diagnosis that is so important for, particularly if it's ruled out, but also across the entire pathway. The majority of people that are on waiting lists are for diagnostics. That's exactly why we're investing in more capital, investing in the staff to make sure that the process is quicker, better for patients. If there are any particular issues about that, if she wanted to write to me about that one, I'll obviously respond to her.
Tom Gordon.
Thank you, Mr. Speaker. Every 17 minutes, someone in Yorkshire is told that they have cancer. Tomorrow, I'll be launching a report for Yorkshire Cancer Research, who are based in my constituency of Harrogate and Knaresborough, and it'll set out key recommendations. Would the Minister meet with us to talk about how we can feed these into the National Cancer Plan?
I think the work that he's doing locally and with that group is absolutely essential. I'll make sure that we do have a good response for him, whether that's meeting with me or my colleague.
Laura Kirksman.
14, please.
Thank you. We are getting the NHS back on its feet, making it fit for the future by shifting care to the community. £889 million for more for GPs, 1,700 additional frontline GPs, 700,000 extra urgent dental appointments annually, and a 19% uplift to the community pharmacy contract. And looking to the future, our commitment to building a neighbourhood health service is right at the heart of our 10-year plan.
Laura Kirksman.
Thank you, and I'm delighted by the government's commitment to moving healthcare closer to the community, including through the establishment of neighbourhood health centres. This is exactly what we need in Aylesbury, and I'm pleased that all our key healthcare providers, including the
NHS Trust and several GP practices are already working together to better integrate their care, which is an important step in the right direction. Can the Minister update me on his progress towards this model of neighbourhood-based healthcare? And can he advise what more Aylesbury's healthcare providers can do to make sure that my residents benefit from the government's work in this area?
Well, I thank her, and it's really good to hear about the fantastic work that's going on in her constituency. We're working with systems to move to a neighbourhood health model by building on existing good practice, particularly around the development of multidisciplinary teams. Aylesbury is an outstanding example of this. Ahead of the 10-year health plan's publication, local communities can continue to make progress by utilising the neighbourhood health guidelines that were published back in January.
Graham Stewart.
Thank you, Mr. Speaker. Dental patients with untreated need end up in hospitals, and in places like Heddon, in my constituency, we're seeing more and more dental practices moving away from the NHS. And I have a constituent who took 3 years to get her child the first checkup, and that dental practice has now ceased to look after NHS patients. She can't get the NHS treatment that she deserves herself, even though she had a child in February. So what is going to be in the 10-year plan that is going to change this and make sure that everyone can get access to NHS dentistry going forward?
Well, he's right to point to the issue around children's dental health. And after we won the election in July, I obviously looked across my portfolio, and it was pretty much a car crash in every aspect of the portfolio, thanks to the incompetence of previous governments. But perhaps the most shocking statistic of all is the biggest reason that 5 to 9-year-old children in our country are admitted to hospital is to have their rotten teeth removed. That is a Dickensian state of affairs, Mr. Speaker. We are working with the British Dental Association on contract reform. We've got to incentivise NHS dentistry, do away with the false economy that was set up under the last government, and get dentistry back to where it needs to be.
Michelle Welsh.
Thank you, Mr. Speaker. The saying goes that it takes a village to raise a baby, meaning that it is those in our community that provide families with vital support. Does the Minister agree with me that we need to invest in more community midwives to ensure families are properly supported through the whole pregnancy and after birth?
Well, I thank her for that really important question. The role that midwives play, alongside other community health services like district nurses, has been chronically underfunded and neglected over the last 14 years. The role of community health care, she will be pleased to know, is front and centre in our 10-year plan, and I think she'll be very interested and pleased with what she sees when the 10-year plan is published.
The chance.
Thank you, Mr. Speaker. The Darcy report pointed out that 13% of hospital beds are occupied by people who are fit for discharge, but they can't get out because social care is broken. Lord Darcy said we cannot fix the NHS until we fix social care. It's nearly 6 months since the Secretary of State promised cross-party talks and a commission, but the cross-party talks were cancelled and never rescheduled, and the commission is delayed. Please, when will the government stop going slow on social care? Please, when can we all get around the table to talk about fixing social care so that everyone gets the care they deserve?
Well, I have to correct her on something. The Commission is up and running. Baroness Casey has started meetings. She had a round table just a few weeks ago with people with lived experience, so she's not correct on that point, and I'm sure she'll want to correct the record. On the point around delayed discharge, she's absolutely right. We are reforming the Better Care Fund to get much better interface between hospitals and care and local authorities. That system and those relationships can and should work much better, but there are very pressing long-term challenges. We are very conscious of that, and we are working at pace with Baroness Casey to ensure that these reforms are delivered.
Liberal Democrat spokesperson Helen Morgan.
Speaker, well, as we've just heard, it's widely acknowledged that the crisis in social care is a cause of dangerously high occupancy rates in hospitals. That leads to the horrors of corridor care, the dreadful waits in ambulance waiting times that we've seen, and a knock-on effect into the community. But when I was contacted by the family of a terminally ill man in Wem in my constituency last month, I was reminded that not only is care often provided in the wrong place, it's often not available at all. So will the government bring forward forward the timeline for the horribly delayed Casey review to report back, get it done this year, and heed Liberal Democrat calls for cross-party talks so that we can agree on a long-term solution for the crisis.
Can I just tackle this idea that we're not working at pace on these issues? Unpaid carers uplift from £151 to £196, the biggest uplift in carers allowance since the 1970s when the policy was brought in. Disabled facilities grant, hundreds of millions of pounds uplift to the disabled facilities grant, and groundbreaking legislation for a fair pay agreement for care workers. These are just some of the immediate steps that we've taken. The first phase of the Casey review will report next year, and of course we continue to work closely with Baroness Casey to deliver the reforms that are so desperately needed after 14 years of neglect, including, of course, a number of years where the Liberal Democrats were in government.
We come to Topicals Challenge List.
Question number 1, Mr. Speaker.
Secretary of State.
Thank you, Mr. Speaker. Waiting lists are at their lowest level for 2 years. We've taken almost 250,000 patients off waiting lists, and for the first time in 17 years, waiting lists were cut in the month of April. There's a long way to go, but this government is finally putting the NHS on the road to recovery. And through our plan for change, I've announced that the NHS will also be at the forefront of the revolution in life sciences. Through the NHS app, patients will be linked up with relevant trials to boost our life sciences sector, generate investment for the NHS and develop the medicines of the future.
Charlie Jewers.
Thank you, Mr. Speaker. Now, it's nearly 4 years since Professor Sir Chris Whitty published his very striking report on health in coastal communities. COVID inevitably delayed implementation. So can I ask the Secretary of State to look at that report again, deliver on the Chief Medical Officer's recommendations, and ensure that my constituents in Bridlington and the Wolds can access the health services that they need?
I thank the honourable gentleman for his question, and he's right to commend Sir Chris Whitty's report. We have taken that into consideration as well as the wider consultation we did in preparation for our 10-year plan for health, which will commit to tackling gross health inequalities that affect our country, particularly in rural and coastal communities.
Chris Law.
Will the Secretary of State join me in welcoming recent NHS waiting list figures that showed that Worcestershire Acute Hospital's NHS Trust has seen a fall of over 6,000 since this government came to office? And does he agree with me that progress like this shows in partnership with our hard-working NHS staff, we can be the generation that takes the NHS from the worst crisis in its history to the NHS people deserve?
Mr. Speaker, I absolutely agree with my honourable friend, and it is thanks to the fact that his constituents sent him to this House of Commons that we have a Labour government able to deliver with him for his community.
Shall the Secretary of State Adaga.
Thank you, Mr. Speaker, and may I, through the Secretary of State, pass on my best wishes to the Parliamentary Under-Secretary of State. In front of the Health and Social Care Select Committee in January, NHS England's then Chief Financial Officer set out that pretty much all the additional funding to the NHS last year would be absorbed by pay rises, national insurance contributions and inflation. What proportion of the latest additional funding will be absorbed in the same way?
Well, firstly, Mr. Speaker, I just don't buy the argument that investing in our staff is somehow not investing in the NHS. Who on earth do they think provides the treatment, delivers the care, organises the clinics and delivers the services? Even in this great new world of technology, the NHS will always be a people-based service, and I'm proud this is a government that delivers for staff. Of course, we're also waging war on waste, and that is how we can deliver fair pay for staff and improve care for patients, if only they'd done that when they had the chance.
Thank you, Mr. Speaker. Well, he couldn't answer that, but hopefully we'll get a more positive response to this one. I recently had the privilege of meeting Dr. Susan Michaelis and her husband Tristan, who set up the Lobular Breast Cancer Moonshot campaign, which large numbers of members across this House of all parties have backed, and which is seeking £20 million over 5 years, a tiny sum in the context of the overall NHS budget, to research lobular breast cancer, which Susan is currently battling, to help improve outcomes. Her immediate ask is even simpler, for the Secretary of State to meet with her in person to discuss the campaign and its aims. He is a decent man. Will he agree to do that?
Thank you, Mr. Speaker. Can I thank the Shadow Secretary of State for his question, and even more importantly, thank the amazing campaigners for what they are doing. This is probably the easiest question he's ever going to ask me. The answer is, of course, an emphatic yes.
Katrina Murray.
Thank you, Mr. Speaker. One of the main concerns I have about assisted dying is it should never be easier to help someone die than it should be to help them live. if passed, the assisted dying bill would make thousands of terminally ill people every year eligible to end their lives on the NHS. Does our health service have the money to fund this service as well as its priority of bringing down waiting lists?
Thank you, Mr. Speaker. Can I firstly thank my honourable friend, the Minister for Care, for the work that he has done, the considerable amount of work he has done to support the House as it makes its deliberations on this important issue. Of course, the government is neutral. It's for the House to decide. There isn't money allocated to set up the service in the bill at present, but it's for members of this House and the other place, should the bill proceed, to decide whether or not to proceed, and that's a decision that this government will respect either way.
Thank
you, Mr. Speaker. The UK is desperately short of doctors, but thousands of applicants will be turned away due to a lack of training places. This is not a situation of the Minister's making, but he has now been in post a year. Can he assure us that nobody, no union, no Treasury Minister, will stop him from doing what needs to be done and lifting the training cap?
Thank you, Mr. Speaker. Of course, I should just say for the record, it's thanks to my friends at the Treasury that we're able to do so much to invest in our health service. Very important to put that on record ahead of the budget. Look, she raises actually a really serious issue. We are looking carefully at what we can do to make sure that we get great people into our health service and they can look forward to a great career. We're not in the right place as a country now. We need to be in a better place. The 10-year plan will set out our ambitions on workforce, and of course we'll be publishing a new workforce plan later this year.
Daniel Francis.
Thank you, Mr. Speaker. It's now 16 months since the publication of the Hughes report, and those patients harmed by sodium valproate continue to await the outcome of the redress that the government will provide them. Will the Minister or the Secretary of State please provide an update on when they can expect an announcement on the redress that will be made available to them?
The Speaker, thank him for that important question. The Government is carefully considering the work by the Patient Safety Commissioner and her report, which sets out the options for redress. This is a complex issue involving input from different government departments, and we will provide a further update to the Patient Safety Commissioner's report soon.
Graham Lambert.
Thank you, Mr. Speaker. In Scotland, in my own constituency, there is a real significant shortage of health and social care workers, despite extensive efforts to advertise the recruitment and to get people in. That's replicated in parts of England, in Wales and Northern Ireland, and it's been, the rug has been pulled out from under that by the changes to immigration policy and visas for that particular sector. Will the Secretary of State commit to pushing this harder in Cabinet to ensure that we can have more geographic and sectoral visas?
Mr. Speaker, I'm really proud of the contribution that health and care workers from overseas make to health and social care services across our country. If they all left tomorrow, the services would simply collapse. But I think there is an over-reliance on overseas staff in health and care services, and that is contributing to levels of net migration that are simply unsustainable. And I have a responsibility to help the Home Secretary bring those numbers down and to give opportunities through better pay and career progression to homegrown talent, and that's what we'll do.
Marcus Campbell-Sabers.
Mr. Speaker, I've received many emails regarding poor service from pharmacies in my constituency. In Maryport, residents report opening times not as advertised, long queues, low stocks and delays receiving vital medication. Can the Minister tell the House how this government will ensure the public gets the best quality service from our local pharmacies?
Well, I'm very sorry to hear about the issues being experienced by the honourable members, my honourable friend's constituents. I understand that my honourable friend has raised this issue with the North East and North Cumbria ICB, who I also understand are investigating his concerns. I'd be very happy to be kept informed, and if he's not happy with the outcome from that investigation, he should certainly come back to me. This government is committed to supporting community pharmacy. After a decade of underfunding and neglect, we recently agreed a record uplift to £3.1 billion for 25-26.
Bob Blackman.
Thank you, Mr. Speaker. The Secretary of State may well be aware of the greater awareness amongst young people of nicotine pouches. This seems to be a gap in the tobacco and vapes bill that is currently going through Parliament. So will he commit to look at this issue to make sure that it is covered and that actually we bar this as well as other forms of tobacco and nicotine?
Thank you, Mr. Speaker. As the honourable gentleman knows through bitter experience, that rotten industry always finds a way, and we have to keep on top of it and tackle the scourge of nicotine addiction. He knows about this better than most, having campaigned so assiduously on the issue. He's right to raise this issue, so let's look at what we can do to strengthen the bill if we can as it goes through Parliament.
Peter Lamb.
Thank you. Could I ask the Secretary of State what steps he is taking to enable access to non-hormonal, non-steroidal oral contraceptives?
Mr. Speaker, these contraceptions are an emerging technology that will be subject to clinical and other relevant assessment before being considered for use in England. The Government remains committed to ensuring women can access their preferred method in a timely manner. A range of contraception is available free of charge from a range of settings. This includes the copper coil, which is a non-hormonal, non-steroidal contraceptive device.
Sarah Bob.
Thank you, Mr. Speaker. In Prime Minister's questions last week, I raised the need for a universal national screening programme for type 1 diabetes. So would the Secretary of State agree to meet with me about this so it could form part of the 10-year plan, given it fits so neatly into prevention of issues like diabetic ketoacidosis, overtreatment?
Thank you, Mr. Speaker. I was in the chamber to hear the honourable member's question. We obviously are led by clinical advice when it comes to the decisions around screening programmes, but I understand the case she's making. We're delighted to make sure she gets a meeting with the relevant minister.
Richard Quigley.
Thank you, Mr. Speaker. Illmount Batten Hospice in my constituency of the Isle of Wight delivers outstanding care across the community. Despite this, Hampshire and Isle of Wight ICB is planning to cut their funding by £1.4 million, while other hospices in the region have their funding increased. I'm deeply concerned that this cut will affect our local health services. Will you meet with me to discuss how we can restore this essential funding and protect hospice care for my constituents?
I thank him for that question. We've provided hospices in England with a record £100 million in capital funding, as he will know. ICBs are responsible for commissioning palliative and end-of-life care services, including hospices, to meet the needs of their local populations. NHS England has published statutory guidance to support this. I would, of course, be more than happy to meet with my right honourable friend to discuss this further.
Eddie Ramsey.
Thank you, Mr. Speaker. The British Dental Association recently published analysis showing that the proportion of NHS funding spent on dentistry more than halved under the Conservatives, failing to account for inflation and demand to the cost of £1 billion. No wonder we have dental deserts across so much of the country. So will the Secretary of State ensure that dentistry receives its fair share of funding from the new NHS funding allocated in the spending review?
Well, he's absolutely right to point to the neglect and incompetence of the last 14 years. We are fighting to get NHS dentistry back to where it needs to be. Important first step, of course, the 700,000 additional urgent appointments, supervised toothbrushing programme, but long-term contract reform is what's needed alongside the investment that will come through the spending review.
Ben Calden.
Thank you, Mr. Speaker. According to the Trussell Trust, the impact of hunger and hardship on people's health is driving an extra £6.3 billion in government healthcare spending. So can my right honourable friend say what part his department is playing in reducing hunger and hardship and thus the related healthcare costs in my constituency of Chelsea and Fulham and across the country?
Right to raise this important point, and it is truly shameful that 4.5 million children in the UK now live in poverty. We are developing an ambitious strategy that tackles root causes, and we are already taking action. Alongside cross-government work on free school meals, breakfast clubs and funded childcare, the Department is investing over £56 million in Start for Life services and supporting healthy diets for 358,000 people through Healthy Start.
Thank you, Mr. Speaker. Opticians are medical professionals that are really important to our community. Unfortunately, when I've spoken to the Integrated Care Board of Hertfordshire and West Essex, they will not allow opticians to perform vital services such as treating minor eye injuries, which they deem too expensive, despite this being the norm in the surrounding areas to my constituency. Will the Minister meet with me to ensure that we actually have a fair system across the country and not a postcode? Thank you.
Well, he's right to point to some of the anomalies we currently have in the eye care system and some concerns particularly as well around the role that some aspects of the independent sector are playing, particularly around the rather lucrative nature of some of the cataract operations. So I'd be happy if he could perhaps write to me to set out the issues, and I guarantee that he will get a response in due course.
Alice MacDonald.
Mr. Speaker. Infertility is a medical condition that affects 1 in 6 couples in the UK, but access to NHS treatment is a postcode lottery, with less than 10% of ICBs in England offering the recommended 3 cycles of IVF. So does the Minister agree that we need to end this postcode lottery, and would he meet with me and campaigners like Fertility Action to discuss how we can end it for good?
Mr. Speaker, in light of the broader pressures on the NHS and looking at changes in the NHS, we have been looking at the ambitions with regard to fertility services and fairness for all couples, and NICE is currently reviewing their fertility guidelines, which will be the clinical standard for the future. I know that she will make sure that she and a group she talks about keeps an eye on that and works with them. Very happy to keep working with her on how we best support ICBs to improve their local offer.
Joshua Reynolds.
Concerns with ministers before about the closure of St Mark's Walk-in Urgent Care Centre in Maidenhead. Frimley ICB have confirmed yet again that they are not going to reopen St Mark's Walk-in Centre against the will of majority of residents in Maidenhead. So will the minister agree to be able to meet with me and local campaigners to see how we can finally get St Mark's Walk-in Centre back open after 5 years of closure?
Mr. Speaker, I'm grateful to the honourable gentleman for his question, and I know his constituents will have noted through his representations he couldn't have fought harder to save that service as a constituency MP. We do devolve these sorts of decisions to ICBs in order to make the decisions closer to the communities they serve, with a conviction that those sorts of decisions are better taken locally rather than centralised in Whitehall. So I understand the case he makes, but as ministers we do have to resist the temptation, having given them a challenge, given them the resources and given them the freedom, not to meddle every time they make decisions that they believe are right for the community, even if they're controversial.
Thank you, Mr. Speaker. Will the Minister look into minimising the pain of patients going through histoscopy and biopsy procedures by requesting medical professionals to ensure that they are fully briefed on anaesthetics and pain relief in advance of the procedure to make sure they can plan accordingly? Thank you.
He raises an important question, and we are committed to improving women's experience of gynecological procedures, including histoscopies. Women should be provided with information prior to their procedure so they can make an informed decision about the procedure and pain relief options, including the option of local or general anaesthetic. And I know he'll probably make further representations, which we will certainly look at.
Thank
you, Mr. Speaker. One of the ways in which the Secretary of State has reduced the waiting list is by turbocharging the use of the private sector since January, meaning that 500,000 people have been treated in irreducible spare capacity. Has that experience elicited any learnings that the Secretary of State is able to take into the wider reform agenda for the NHS?
Absolutely. The NHS always does better under a Labour government.
Nesl Kelliscone. Nesl.
Thank you, Mr. Speaker. Barking Community Hospital in my constituency has been providing pre-antenatal services to mothers in Barking for many years, and women also use the services to give birth. Therefore, I was really disappointed when I heard last week that that service of maternity birthing unit is likely to close. And many in my community, as you will imagine, are deeply concerned. They're being redirected to Newham General Hospital, where the CQC has rated it as requires improvement. Women deserve to give place in a safe clinical environment. Will ministers ensure that they are making sure there is additional attention and resources provided to Newham Hospital so that they improve their standards, and my constituents who are being redirected to give birth there can give birth in a safe clinical space?
Speaker, making sure that women are giving birth safely is the ultimate priority and the least that women deserve. I understand the anxieties she has about this reconfiguration. She's right to raise them with the ICB in the first instance. We're happy to meet with her as ministers too. The crucial thing is that the services are configured and delivered in a way that prioritises the safety of women and their babies.
James Wilde.
Thank you, Mr. Speaker. In March, the Care Minister told me that no decision could be taken on a new dental school at the University of East Anglia until the spending review settlement was known. Well, now we know it. Will he instruct the Office for Students to allocate new training places at the UEA from 2026?
Well, I thank him for that. Of course, the spending review has just been published. The key now is to secure the allocations within the overall financial envelope. That will take a matter of weeks, and I'll be happy to report back to the honourable member once we have that clarity.
Abraham.
Between 2001 and 2011, the 15% health inequalities weighting in NHS allocations made a positive, measurable difference to the health of deprived people. Unfortunately, it was cut in 2015 to 10%. So with the spending reviews increase in funding to the NHS, when will the health inequalities weighting reach 15%?
I'm really grateful to my honourable friend for her question. She's right to highlight the importance of funding following inequalities to redress that imbalance. I think she'll be pleased with where we are with the 10-year plan for health, and I'd be delighted to meet with her to discuss it.
Richard Ford.
Thank you, Mr. Speaker. People in East Devon have been told that they must now travel to Exeter for audiology services that they had previously received at their local community hospital. What steps is the government taking to encourage new providers to restore accessible audiology services?
Mr. Speaker, I mean, this has been a running theme this morning, which won't be lost on ministers. We will make sure, as we're delivering neighbourhood health services, that people can receive care closer to home wherever they live. And we've heard that message loud and clear today, and I think you'll see that priority reflected in our 10-year plan for health.
Hello.
Mr. Speaker, and I declare an interest. My brother's a GP. My residents, when they are able to get a GP appointment, are being frustrated when they're sent halfway across the borough to a different GP surgery to the one that they're registered with by their PCN. Is this something that we can address, and is this part of our proposals in the new GP contract?
Well, Mr. Speaker, we do want to put GPs at the heart of neighbourhood health services, and we want people to have care close to home. There are benefits to primary care working at scale, so I wouldn't want to criticise them for doing that. I think the important thing is different courses for different horses. For some of us, we're much more mobile, much more active, much more online, and would welcome that flexibility. For others, continuity of care close to home or indeed in their home is important. It's important people get the right care in the right place at the right time wherever they live, and that's what we'll deliver.
So Jeremy Wright.
Thank you, Mr. Speaker. I'm grateful for the consideration I know that the Secretary of State's already given to finding a fairer and more effective way of compensating those injured by a COVID vaccination, but he knows that those who are profoundly affected by such injuries are anxious for news. So can he give me, and indeed them, a progress report?
Yes, can I just reassure the right honourable gentleman and his constituents I've met and other campaigners, I am having discussions with the Cabinet Office about how we deal with this and other issues that have been raised this morning, including on issues like the sodium valproate scandal too. He knows the complexities involved, and I've been grateful for his advice as a former Attorney General too. I don't have specific progress to report now, but I can certainly reassure him and campaigners that this has not gone off the boil, and we are working to find a resolution.
Hello, Hazelgrove.
Thank you, Mr. Speaker. The challenge of finding and keeping an NHS dentist is one that has raised with me time and again across the Filton and Bradley Stoke constituency, and I really welcome the early action this Labour government has taken to introduce more than 19,000 urgent care appointments across our ICB area. Could I please ask the Minister what the next steps will be to help ensure that NHS dentistry is opened up again to everybody?
I thank her for that question and her relentless campaigning on this issue. She's right that the 700,000 urgent dental appointments is a first step. We're looking to embed that so that that goes forward in every year of this Parliament. But the broader issue is around contract reform. There is no perfect contract system. The current one clearly isn't working, and we're looking at options around sessional payments, capitation, and getting a contract that actually works and brings a dentist back into the NHS.
Thank you, Mr. Speaker. The Secretary of State will know that my local ICB in Bedfordshire, Luton and Milton Keynes is set to merge with Hertfordshire, Cambridgeshire and Peterborough. The new ICB will cover a population of about 3 million people. Given the difficulties we've had securing GP surgery in Wixhams, could the Secretary of State set out how supersising this quango will help rural mid-beds get the local health care it needs?
Well, Mr. Speaker, can I just respectfully say this was part of the problem with Conservative thinking. They thought the answer to the NHS crisis was more quangos, and they measured success in the number of ICBs, not in the number of appointments and the size of the waiting list. We're taking a different approach, slashing bureaucracy and reinvesting into the front line, not centralising, decentralising and cutting waiting lists, a record the party opposite cannot begin to touch.
Mr Speaker. A couple of weeks ago at my constituency surgery through the tears, my constituent Amy explained how following a hip operation in 2008, she suffered progressive nerve damage due to repeated failures in diagnosis, referral and treatment. Despite raising concerns for years, she was told her pain was common, and a nerve test in 2015 confirmed damage, and further tests last year showed a significant deterioration. After 17 years, she's only now been offered surgery. All Amy wants to know is what steps are being taken to ensure that no other patient is left permanently disabled due to such prolonged and systemic failure.
Order. Very important, but why do you not want other people to get in? Secretary of State.
Mr Speaker, can I first of all, on behalf of the NHS, apologise to his constituent. That is a totally intolerable situation, but sadly not rare or exceptional. There's too much of that happening, and a culture of cover-up and covering reputations rather than being honest with patients about failures. We are changing the culture. Safety is at the heart of the 10-year plan, and I'd be delighted to talk to him further about his constituent's case.
Jim Shannon.
This morning I met an event on bladder cancer. Bladder cancer is the 5th highest killer in the United Kingdom. They were anxious to meet the Minister and discuss these matters. So would the Minister agree to meeting the Bladder Cancer Organisation to take forward the 4 objectives that they have to make it better for people in the United Kingdom? Thanks so much.
Mr Speaker, I'm sure my honourable friend, the Cancer Minister, would be delighted to meet campaigners, particularly as we put together the National Cancer Plan, and we want to make sure we capture every type of cancer in that and genuinely improve cancer care for everyone in our country.
Final question, Oliver Ryan.
Thank you, Mr Speaker. The Minister may have seen my constituent Molly Mulherron recently featured on Newsnight. Our local ICB recently refused her access to fertility treatment after recovering from an aggressive cancer, with a high likelihood that her illness will return. Will the Minister meet with me and Molly to discuss this issue and access to fertility for cancer survivors and patients?
Yes, we'll make sure my honourable friend gets that meeting.
That completes questions. Point of order, Dr Caroline Johnson.
Mr Speaker, during proceedings of the House of Commons on the 2nd of June 2025, it became clear that some media organisations had been given access to the SDR before Parliament. And it also became furthermore aware that the timing of such early access may have been different for different organisations. I asked a parliamentary question on that matter of who and when. They didn't answer the question, but they made it clear that trade associations and think tanks had also been given early access. I asked again, they refused to answer, but made it clear the trade unions and our people had been given early access. Mr Speaker, ministers are required to answer these questions using the Nolan principles, which include accountability and openness, which says that information should not be withheld from the public unless there are clear and lawful reasons to do so. The government has not followed these processes when answering this question, and it's particularly relevant to this minister because in his declaration of interest, he declares membership of the GMB and Unite, and that a family member is working as a constituent for Babcock International. Oh. And
Please, you raised a point of order with me, but you can't go into a full speech. I've got the message, and I'm very clear on the message. Can I first of all say I have no responsibility for the quality of answers for written parliamentary questions, but I know, and this is the key, that the Procedure Committee takes a close interest in this matter. She might therefore like to raise it with the Honourable Member for Lancaster and Wyre, who chairs the committee, in order to see that... Let me finish with this one, please. So therefore, that would be a good way to take this forward. Okay. Point of order, Mark Francois.
Speaker. Regarding this matter, we now know undoubtedly that the Sunday Times was given access to the White Paper because you could read most of it in the Sunday Times the day before Parliament did. Although, crucially, the article did not mention the up to 12 new SSNs. I'll explain in a quick second, sir, why that's important. At 10:30 a.m. on the Monday morning, journalists were invited to a reading room in Horse Guards Parade where they were given access to the White Paper. Section 811 of the Ministerial Code very clearly states, and I quote it, where commercially sensitive material is involved, no copies should be made available to the media before publication, thus clearly a breach of the code. But there was an earlier sitting in the reading room at 8 a.m, sir, when we know it was also seen by members of defence companies, trade associations, academics, think tanks and trade unionists at the same time that the markets were opening at 8 o'clock. So, Mr Speaker, there is a possibility of insider trading. Babcock's share price, and they would benefit from maintaining SSNs, leapt very early on after 8. So, Mr Speaker...
No, please. Don't take advantage of the chair. We know that they're meant to be a little bit more punchy. They aren't full-blown statements. I take very seriously the points that have been made. That's why I actually raised them myself at the time. So you reiterating my words, I'm very grateful. But what I would say is that I have no responsibility for the ministerial code. That, if the House wishes, needs to change it. Because unfortunately, it makes a nonsense. There is a ministerial code there. The fact is that it is not being kept as we expect it to. But it is for this House. If it wishes to change the ministerial code, please do so. Or I'm more than happy for the government to change it if they cannot accept it. But what we cannot have is this continuation of breaking the ministerial code. It is appalling. It is unacceptable. Because in the end, it is not a political point. I am here to uphold the rights of the backbenchers. The backbenchers should be the ones that hear it first. The fact that if documents are going to be given, they should be given to MPs. It is about me supporting MPs. But unfortunately, in this particular area, I have not got the power. I wished I had, because it would be different. Right, let us move on. Point of order.
I seek your advice, Mr Speaker. Over the last few days, we have recognised Joe Cox's murder. As the member responsible for the safety of members of Parliament, can you advise me, with the additional focus that members in this House and encouragement of targeting of MPs with false information, do you have advice on how, as members, we should be behaving both in this chamber and online?
What I will say is, first of all, we will never discuss the member security on the floor of the House. With issues, please come and see me privately. Let me see what I can do to ensure and reassure members. But I certainly don't want to open a debate, so I don't think that would add to members' safety. So no, please, come and see me privately. Right, we now come to presentation of Bill. Peter Dowd.
Multi-storey car parks.
Second reading what day?
4th of July, sir.
4th of July. Thanks, Peter. Right, we now come to the 10-minute rule motion. Jen Craft.
Thank you, Mr Speaker. I beg to move that leave be given to bring in a bill to make provision for the inclusion of a parent's details on a child's birth certificate where that parent has died before the birth of the child. For the vast majority of parents, registering the birth of their child is a straightforward process. It is a simple piece of paperwork which marks a special moment, and one that brings important recognition of their new family, along with notable legal rights. Yet for a number of women every year, what should be an uncontroversial step in their journey as a parent becomes a protracted and traumatic legal battle. The law dictates that it's the duty of the parents to register the birth of a child within 42 days. For married couples, there is a presumption of paternity for the husband under the law. This means either parent may register the birth unaccompanied by the other, with both still recorded on the birth certificate. However, in the terrible event that their husband dies before the child is born, a widowed mother can therefore still ensure their name is on the birth certificate, which is common sense. However, if the couple are unmarried, the law does not recognise their relationship in the same way. The fact the mother does not have a ring on her finger means there is no automatic recognition of paternity. If an unmarried woman experiences the unimaginable tragedy of losing her partner during pregnancy, there is no provision for her to register them on the child's birth certificate. Unless both parents can be present, the registrar is deemed unable to verify the paternity of the father. While suffering the grief of losing a loved one and facing the new reality of parenthood alone, bereaved mothers leave the registry office with a blank space on their child's birth certificate instead of their partner's name. In order to amend the birth certificate, they have to seek a declaration of parentage through a lengthy, costly and traumatising legal process in the family courts. In some respects, this is a legal loophole, the effect of improper and outdated legislation that has failed to provide for a certain set of particularly tragic circumstances. But it speaks to a deeper inequality within the legal system, that unmarried couples are held in lower regard. The law in this area has not kept pace with societal change. The charity Widowed and Young first brought this injustice to my attention. They are an organisation which provides fantastic support to those who have experienced widowhood earlier in life. And I would like to pay tribute to the Honourable Member for South Devon, who secured an adjournment debate on this issue and spoke powerfully and movingly of her own experience of bereavement. And also to the Honourable Member for Walthamstow, who first exposed the shortcomings of the legal process in Parliament in 2016. This bill seeks to legislate for Widowed and Young's Blank Space campaign to come into existence, to provide a clear and simple process for unmarried and bereaved mothers to register their partner on their child's birth certificate. Through this charity, I've heard the stories of brave and inspiring women, some of whom are in the gallery today to watch the proceedings. And I would like to share their experiences which illustrate the emotional impact of this issue. When Kelly's husband, Jordan, died suddenly in 2020, she went from planning their future to planning her fiancé's funeral. Shortly after she gave birth to their daughter, Kelly's battle began to prove that Jordan was the father. As Kelly said, he had wanted nothing more out of his life than to have kids, so she was determined his name would be on Maisie's birth certificate. Kelly used a C63 form to apply for a declaration of parentage through the family courts, which comes with an immediate cost of £365. While having to provide DNA from Jordan's mother and paying out hundreds of pounds in legal fees, Kelly was also asked demeaning questions like whether she had had any other partners. After fighting for 2 years, Kelly received a birth certificate for her daughter Maisie with Jordan's name on it. She now keeps 12 copies of it around the house and one in her purse at all times. Orlando and her partner Julian were on holiday when he unexpectedly collapsed. Just a day after discovering they were expecting a baby girl, Julian died from a heart attack. When the registrar told Orlando that Julian would not be named on her daughter's birth certificate, she said it felt as if he had been ripped from our history. Her process through the courts took 2 years and 4 hearings. Many of the judges she encountered had never even come across a situation like hers, and she was often asked at hearings if Julian would be attending. As an ambassador for Widowed and Young, Orlando says she is determined to make it easier for women who follow in her path. And to Sophie. Sophie is still in the midst of this torturous process. The sudden death of her partner Lawrence while she was pregnant with their daughter Kinley turned her world upside down. Despite having 2 children together previously, with Lawrence legally registered as the father of both, Sophie was told he would not be registered as Kinley's father. She was devastated. Registering their son together in 2016 was one of Lawrence's proudest moments. She says he will always be her dad and should be recognised as such. Sophie entered the uphill battle of amending the birth certificate and being bounced between departments and advisors until someone at the Children and Family Court Advisory and Support Service intervened on her behalf. Her hearing is at the Magistrates' Court on 3rd of July and will hopefully bring her some closure to this issue. Sophie says the experience has been exhausting, confusing and emotionally draining. And I would like to add my personal thanks to the women who join us today for sharing these brave stories and allowing me to share these with the House. Kelly, Orlando and Sophie's short stories show how traumatic and unnecessarily complex this process is. Widowed and Young estimates that this affects as many as 200 women each year. And while the women who join us today have persevered through the family courts, there are many mothers who will give up out of frustration, leaving that blank space on their child's birth certificate. The system for registering births is governed by Section 10 of the Births and Deaths Registrations Act 1953 and Section 55A of the Family Law Act 1986, which makes provisions for acquiring a declaration of parentage. Neither of these acts provides for the specific circumstances where one parent is deceased and a child is born outside of marriage. A declaration of parentage is not intended for proving the paternity of a deceased partner, but rather resolving a disputed parenthood. This legal framework is unfit for purpose. When the Births and Deaths Registration Act became law in 1953, 95% of births registered in the UK were within a marriage. This figure has reduced steadily ever since, with only half of children now born within marriage. Times have changed, society has moved on, yet the law has not kept pace. This bill would drag the legislation into the 21st century to provide a clear and simple process for registering a deceased partner's name on a birth certificate. We can achieve this by placing greater responsibility on a registrar's professional judgment. With the right evidence, registrars are allowed to amend a birth certificate, so we can similarly empower them to correct an absence of a deceased parent, provided they receive sufficient evidence of intended parenthood. Across Europe, in Switzerland, France and Germany, unmarried parents are encouraged to register their parentage at antenatal appointments, and a similar system could be created here, with a declaration of intended parentage made during pregnancy. I do not contest the importance of a rigorous process to approve intended parenthood, but this is an argument in support of a change in the law, not against it, because currently this process is non-existent. Officials are often unable to advise women about how to register their deceased partner as a parent because there is no guidance. And while there remains no clear route to providing intended parenthood, bereaved unmarried mothers are being denied a basic right. This anachronistic legal framework is causing immense trauma for mothers and children. This bill would take direct action to redress this injustice. It would provide a clear process for bereaved mothers to follow and allow the registrar to include a deceased partner on their child's birth certificate. This small change in the law would make a huge difference. It would spare grieving women a needlessly painful legal process and ensure that no mother and no child has a blank space on their birth certificate where their parent's name should rightly be.
The honourable member have leave to bring in the bill. The question is that the honourable member have to leave to bring in the bill. As many of that opinion say aye. Aye. The contrary, no. The ayes have it. The ayes have it. Who will prepare to bring in the bill?
Stella Creasley, Caroline Voden, Alice MacDonald, John Grady, Chris Vince, Abbott Sam Mohammed, Kirith Entwistle, Marie Tidball, David Burton Sampson, Daniel Francis, Charlotte Nichols and myself, Mr Speaker.
Gencraft.
Thank you. Registration of births, inclusion of deceased parents bill.
Second reading what day?
July the 11th.
July the 11th. Well done, Jan. Right, we now come to the programme motion. Minister to move. Formally. The question is that the Crime and Policing Bill, motion as on the order paper, as many of that opinion say aye. Aye. The contrary, no. The ayes have it. The ayes have it. The clerk will now proceed to read the orders of the day.
Crime and Policing Bill as amended in Public Bill Committee to be considered.
We will begin with Government New Clause 52, with which it will be convenient to consider the other new clauses, new schedules and amendments listed on the selection paper for the first part of day one. I call the Minister to move New Clause 52. Dame Diana Johnson.
Thank you, Mr Speaker. Before I speak to the key government amendments tabled on report, I would like to quickly remind the House why the Government has brought forward this bill. The bill is a vital part of our Safer Streets mission. It contains a host of measures to tackle antisocial behaviour, retail and knife crime, and the epidemic of violence against women and girls, and to restore confidence and trust in policing. It's worth reminding the House that on the previous government's watch, shoplifting soared to record high levels, a 70% increase in the last 2 years in office alone. Street theft was rapidly rising, up almost 60% in just the last 2 years. Antisocial behaviour was rampant in our towns and cities, with 1 million incidents last year. In the year to June 2024 survey, the Crime Survey of England and Wales estimated that 25% of people perceived antisocial behaviour to be a fairly or a very big problem in their local area. That's the highest levels since at least March 2013, over a decade. And we know that violence and abuse against shop workers was at epidemic levels. The British Retail Consortium said that incidents of violence and abuse against shop workers stood at over 2,000 incidents a day in 23-24, up almost 50% on the previous year, and nearly treble pre-pandemic figures from 2019 to 2020. I'm happy to give way. Yes.
I'm very grateful to her for giving way. And on that point, I have been down to the local co-op in Chesterfield, met one of the shop workers who faced terrible attack. Luckily, the people were jailed. But in so many cases, there was a sense that shoplifters were able to walk out the door without anything being done. The traumatic effect that it had on shop workers only had to be seen to be believed. Will she say, as a result of this bill going through now, that the message to anyone who wants to walk out of a store is the police will now be coming after you and you will end up going to jail?
Absolutely, and my honourable friend puts that very well, and we of course know that attacks on retail workers are totally unacceptable, and I think the work that the Co-op and Usdaw have done to highlight this and to make sure that this now is going to be enacted in this bill is really very important. I just think it's also worth saying that a number of the crime types that I've just been talking about, the previous Conservative government wrote off as low-level crime and allowed it to spiral out of control. And this was at the same time that they decimated local neighbourhood policing teams, causing, as we all know, untold damage to our communities. Yes, I'm happy to give way, yeah.
To the Minister for giving way, because on that specific point about neighbourhood policing, I do welcome the fact that we've got some extra capacity coming into the West Midlands, but I'm still, Mr Speaker, I've not really had clarification yet as to whether the money that's coming to the West Midlands is actually going to cover all the extra national insurance costs. And I know that the Labour Police and Crime Commissioner is already saying that his budgets are underfunded under the Labour government.
Minister.
Well, the Honourable Lady, the Right Honourable Lady and I have had this discussion before, and I have made it very clear that the national insurance increases have been funded in the money that is available to police forces this year. That is in stark contrast to the fact that the previous government did not make a proper allocation for the police pay award for this year, for last year, that this government then had to supplement when we came into power in July. Yes, I'm very happy to give way.
I thank the Minister for giving way. Would she join me in celebrating the 5 new neighbourhood police officers we have in Harlow? I can't take all the credit for them because I only taught one of them maths.
Absolutely, and I think we will have 3,000 additional neighbourhood police officers by the end of March next year as part of our commitment to the 13,000 neighbourhood police officers that we will have by the end of this Parliament. If I move on to now say, Mr Speaker, that it has been clear throughout the bill's passage that the measures contained within this bill command, I think, broad support across the House. And I hope over the next 2 days, Right Honourable and Honourable members from all sides can come together and recognise the shared goals that this bill fulfils. The Government is tireless in our drive to make our streets safer. Happy to give way, yes.
I'm very grateful to the Right Honourable Lady for giving way, and she's setting out very clearly what the bill was intended to be, and indeed she rightly points to the cross-party support for the main thrust of it. Would you agree with me, therefore, that that unanimity of purpose is put in quite some grave jeopardy by the Christmas treeing of significant abortions with regard, and I know she has a personal interest in this when she sat on this side of the House, with regards to very dramatic changes which require to abortion law, which require a much fuller debate in this place than just an amendment to a bill, the purpose of which she has set out, which the government never intended to be a Christmas tree but has become one. She risks, the House runs the risk of fracturing that unanimity of purpose were those amendments to be pressed to a vote and become part of the legislation.
Well, I don't want to try Mr Speaker's patience, because obviously there is an allocation this afternoon for that debate to take place. What I would say is, and the Honourable Gentleman is a very experienced member of this House, and he will know that crime bills often become Christmas tree bills because of their very nature, and that members wish to bring forward amendments on all sorts of areas of the criminal law. So we have the bill that's before us today with the amendments that have been tabled. But what I was just going on to say was that the government, and I hope other parties in this House, are committed to making our streets safer, and where there are gaps in the law, we will not hesitate to address them. So these amendments that have been tabled for report stage are very much directed to this end. So if I could start to go through the government amendments. First of all, dealing with child criminal exploitation. New Clause 54 will aid legal certainty and the consistent application of the new offence of child criminal exploitation. This new clause makes clearer to the courts that the offence is focused on the criminal intentions of the adult only rather than the child, and put beyond doubt that the offence captures circumstances where the child is used as an entirely innocent agent, where a child cannot satisfy all the elements of the intended criminal conduct themselves. This new clause also puts beyond doubt that the offence is capable of capturing the earlier stage grooming, and as such addresses the concerns raised in Amendments 4 to 6 tabled by the member for Brighton Pavilion, as well as perpetrators who arrange for another person to exploit a child on their behalf. And at the request of the Scottish Government and the Department of Justice in Northern Ireland, we are also extending this offence to Scotland and Northern Ireland. Moving on to coerced internal concealment, new clause 56 criminalises the highly exploitative and harmful practice of coerced internal concealment. It is commonly associated with county lines drug dealing and involves a child or adult being intentionally caused to conceal drugs or other objects, such as weapons or SIM cards, inside their bodies to facilitate criminality. The new clause creates two new offences. The first targets perpetrators who intentionally cause a child to conceal a specified item inside their body. The second new offence applies where an adult victim is caused to internally conceal a specified item through compulsion, coercion, deception, or through controlling or manipulative behaviour, and intends, knows, or reasonably suspects that the item has been or may be used in connection with criminal conduct. These new offences will carry a maximum penalty of up to 10 years imprisonment. If I turn to new clause 57, which replaces clause 52, this enables the Secretary of State to issue statutory guidance to the police and others in respect of their exercise, of their functions relating to the new coerced internal concealment and cuckooing offences, as well as the child criminal exploitation offence and prevention orders. New clause 58 confers a similar power on the Department of Justice to issue statutory guidance to the Chief Constable of the Police Service of Northern Ireland in relation to the exercise of their functions relating to the CCE and cuckooing offences. Moving on now to controlling another's home for criminal purposes, Clause 53 creates an offence of controlling another person's home for criminal purposes, known as cuckooing. The offence applies UK-wide. Clause 56 then adds the cuckooing offence to the list of lifestyle offences under Schedule 4 to the Proceeds of Crime Act, POCA, 2002, which applies to Scotland. Parallel changes are made to Schedules 2 and 5 of POCA, which apply to England and Wales and Northern Ireland respectively. At the request of the Scottish Government, Amendment 57 to Clause 56 removes the amendment to Schedule 4 to POCA. Now moving on to child sexual abuse material, Clause 57 creates a new offence which criminalises the making, possession, adaptation or supply of digital files or models designed to create child sexual abuse material, and the offence applies to England and Wales. Amendments 59 to 68 to Clause 57 better provide for protection from liability for the offence for the provider of an internet service who acts as a mere conduit for or who caches or unknowingly hosts a CSA image generator provided by a user. It extends liability to a natural person who is responsible for a body corporate, partnership or unincorporated association committing the offence, removes the definition of a CSA image generator that is a service, and on reflection we have concluded that a CSA image generator cannot be used as a service as an offender would require possession of the generator to use it, and it amends the scope of the power to make regulations governing the testing of technology that might amount to a CSA image generator to ensure it is correctly targeted. Clauses 59 provide for an offence of administering or moderating of electronic services with the intention of facilitating child sexual exploitation and abuse. The term child sexual exploitation and abuse is, in part, defined by reference to a list of offences in Schedule 7 to the Bill. New subsections 6 to 8 of Clause 59 add a regulation-making power subject to the draft affirmative procedure to ensure that the list of offences can be kept up to date, in particular when new offences are created by acts of the Scottish Parliament or Northern Ireland Assembly. In addition, amendments to Schedule 7 add further Scottish offences to the list of child sexual exploitation and abuse offences specified for the purposes of Clause 59, and these amendments apply UK-wide. Guidance about disclosure of information by police for purposes of preventing sex offending. Clause 76 confers powers on the Secretary of State to issue statutory guidance about the disclosure of information by the police for the purposes of preventing sex offences. Chief officers of police are required to have regard to the guidance. This provision applies to police forces in England and Wales, the British Transport Police, which operates GB-wide, and the Ministry of Defence Police, which operates UK-wide as well. At the request of the Scottish Government, Amendment 70 limit the application to BTP to England and Wales only. Alongside the new offences in this bill to tackle intimate image abuse, the Data Use and Access Bill includes an offence of requesting the creation of a purported intimate image without consent or reasonable belief in consent, including provisions relating to the powers of the civilian courts to deprive offenders of images and other property. To ensure consistency in the service justice system, an amendment is required to the Armed Forces Act 2006 to give the same deprivation order powers to service courts. Amendments to the AFA 2006 require consent from the British Overseas Territories and Crown Dependencies to whom the Act applies, which it was not possible to gain in time during the passage of the Data Use and Access Bill, so we propose to make the amendments in this bill instead. There are also amendments around dangerous cycling. The bill was amended in committee to provide for offences related to dangerous and careless cycling, and Amendments 74 to 76 make various consequential amendments to the Road Traffic Offenders Act 1988 and other enactments. Access to driver licence information. Clause 120 clarifies the existing powers of the Secretary of State to provide access to driver licensing information held by the DVLA to various policing and law enforcement bodies for policing and law enforcement purposes. Amendment 87 makes employees of the Economic Crime and Confiscation Unit in Jersey authorised persons for the purposes of these provisions. Moving on now to abusive behaviour towards emergency workers. Yes, happy to give way.
Jim Shannon.
Minister, quite clearly the issues and the legislation, the bill before us today is for England and Wales, but there's a real important aspect of that the share of knowledge, the share of information with the Northern Ireland Assembly, with the Scottish Parliament, for example, so that they will be aware of what's happening here, and those who may move from England or Wales to Northern Ireland or to Scotland. It's just to ensure that the exchange of information between the police forces and between the authorities in the devolved administrations and here takes place. I feel if we want to have security and safety for all of our people, we really need to have that. Thanks very much.
Well, I totally agree with the honourable member, and I think that sharing of information and good practice and policy development is really important, and I hope that will go from strength to strength under this government. If I return to what I was saying about emergency workers, we all know that emergency workers put themselves in harm's way to protect us all every day. They deserve robust protection in return. This includes protection from racial and religious abuse, which is not only deeply harmful but also undermines the values of decency, respect and public service. Unlike most people, emergency workers cannot walk away from abuse. When they enter a private home, they do so not by choice but because it's their duty to do so. Whether responding to a 999 call, providing urgent medical care or attending an incident involving risk to life or property, emergency workers are legally and professionally required to remain and act. They cannot remove themselves from the situation simply because they are being abused. The law must recognise this and ensure that they are properly protected in every setting, including private dwellings. At present, there is a clear and pressing gap in the law. Although existing legislation provides important protections against racially and religiously aggravated offences in public places, those protections do not extend to abuse that occurs inside private homes. Policing stakeholders have highlighted this gap and emphasised the need for stronger safeguards for emergency workers. New clauses 60 to 62 therefore introduce specific offences relating to the use of racially or religiously threatening, abusive or insulting words or behaviour towards an emergency worker acting in the course of their duties. Crucially, this includes incidents that take place within a private dwelling. This is a focused and proportionate measure. It does not interfere with freedom of expression. Rather, it reinforces the principle that emergency workers should be able to carry out their critical roles without being subject to hate or hostility because of their race or religion. And I hope the honourable member for Esher and Walton will agree that these government new clauses achieve the underlying purpose of her new clause in 120. Now, turning to war memorials, Mr Speaker, Clause 112 strengthens the protection afforded to nationally significant war memorials by providing for a new offence of climbing on specified war memorials without lawful excuse. We believe that the same protection should now be extended to other nationally significant memorials, starting with the statue of Sir Winston Churchill in Parliament Square. The Churchill statue is a prominent national symbol of Britain's wartime leadership. This has repeatedly been targeted and climbed upon during protests in recent years. Including it within the new offence ensures consistent protection of one of the foremost culturally significant monuments linked to national remembrance. Amendment 77 to 84 therefore expands the scope of the new offence to include other memorials of national significance, in addition to adding the statue of Sir Winston Churchill to the list of specified memorials already set out in Schedule 12 to the bill. I just want to now turn to remotely stored electronic data. New clauses 63 to 70 and 81 and new Schedule 1 clarify powers for law enforcement agencies to access information stored online and extract evidence or intelligence for criminal investigations to protect the public from the risk of terrorism and safeguard our national security. The powers will apply where law enforcement agencies have lawfully seized an electronic device as part of national security examination at UK borders or where a person provides their agreement. New Clause 70 also amends the Investigatory Powers Act 2016 to permit the interception of access-related communications, such as two-factor authentication codes. These reforms are necessary to ensure our law enforcement agencies have clear powers to access vital evidence and intelligence when investigating serious offences including child sexual abuse, fraud, terrorism and threats to national security, amongst others, at a time when more and more information is stored remotely in the cloud rather than on people's electronic devices. Turning now to new clauses 72 to 79 and new Schedule 3, a crucial aspect of our Safer Streets mission is to rebuild public confidence in policing. Amongst other things, this means ensuring that only those who are fit to serve can hold the office of constable or otherwise work in our law enforcement agencies. Alongside strengthening the vetting regime for police officers, these new clauses require the National Crime Agency, British Transport Police, Civil Nuclear Constabulary and the Ministry of Defence Police to establish barred persons lists and advisory lists similar to those created in 2017 for territorial police forces in England and Wales. The chief officers of these forces and others will be under a legal duty to consult these lists before employing or appointing an individual to prevent those dismissed from policing from rejoining another force in the future. Mr Speaker, my right honourable friend the Home Secretary has announced a new police efficiencies and collaboration programme to cut waste and bureaucracy. It is important that undertakings providing services to the police are delivering the most benefit and unlocking the efficiency savings needed by forces to achieve better outcomes for the public. In announcing the Government's intention to consult on establishing a new National Centre of Policing, the Home Secretary said that she envisages the body being responsible for existing shared services, national IT capabilities and force-hosted national capabilities. It is right that the Home Secretary has the powers to ensure these capabilities are fully aligned to the priorities of the Police Efficiency and Collaboration Programme and that they are adequately prepared for transition into the new body with no disruption to service delivery. New Clause 80 ensures that the Home Secretary has the power to direct undertakings providing critical services and capabilities to policing to take appropriate action to strengthen their service delivery, to better deliver our efficiencies programme and, ahead of any future legislation, to establish the National Centre for Policing, to remove any barriers to the transition of services into that new centre. Turning now to begging, we have tabled new clauses 52 and 53 against the backdrop of the Government's commitment to bring into force the repeal of the outdated Vagrancy Act 1824, which criminalises begging and many forms of rough sleeping. It is generally the case that where begging reaches the threshold of antisocial behaviour, there are already sufficient powers available to the police and others to address this. But we have identified two gaps in the law that will arise from the repeal of the 1824 Act, which these two new clauses seek to address. New Clause 52 creates a new criminal offence for any person to arrange or facilitate another person's begging for gain. Organised begging, which is often facilitated by criminal gangs, exploits vulnerable individuals and can undermine the public sense of safety. This provision makes it unlawful for anyone to organise others to beg, for example by driving people to places for them to beg. This will allow the police to crack down on the organised criminal gangs that use this exploitative technique to obtain cash for illicit activity. Yes, happy to.
I thank the Minister for being very, very generous with her interventions. Having worked for a homeless charity, I know seen this issue firsthand. Would she agree with me that when there is this organisation behind the begging, actually the person that is being forced to beg actually is being exploited? So actually these laws will actually help to tackle a form of exploitation.
Minister.
I think my honourable friend makes that point very well. These are exploited individuals, again by serious organised criminal gangs, and we are going to clamp down on their activity. New Clause 53 reenacts the offence of being in an enclosed premises for an unlawful purpose. This will make it an offence for a person to trespass on any premises which covers any building or part of a building or enclosed area with the intention of committing an offence. Without this replacement offence, the police would only be able to rely on trespassing legislation as set out in the Theft Act 1968, which only covers trespassing in relation to burglary. It is important that the police have the powers to tackle all cases of trespassing with intent to commit an offence, and new clause 53 will ensure that that is the case. Moving on to extradition, new clause 82 amends the Extradition Act 2003. Under that act, the UK can accept extradition requests where the requested person has already been convicted in the requesting state. When considering these cases, if the requested person was convicted in their absence and a UK judge determines they did not deliberately absent themselves from their trial, a UK judge is bound by the 2003 Act to determine whether the individual is entitled to a retrial in the requesting state. This new clause firstly aligns the provisions of the 2003 Act with the Trade and Cooperation Agreement, which governs the right to a retrial in the context of UK-EU extradition cooperation. This will improve legal certainty and remove opportunities for confusion in the extradition system. And secondly, the new clause responds to a recent Supreme Court ruling to the effect that the current drafting of the 2003 Act should be read as requiring a guaranteed retrial in the requesting state. The 2003 Act had previously been interpreted as a right to apply for a retrial subject to the domestic laws of the requesting state. There are several states which cannot offer assurances to meet the conditions imposed by the judgment, and there is therefore a public safety risk of individuals being discharged if the new interpretation of the 2003 Act were left to stand. Therefore, new clause 82 reinstates the previous interpretation that only the right to apply for a retrial is required to permit extradition in a case where the person was absent at the trial. I also just want to comment on a few other government amendments. First of all, during committee, the government added to the bill what are now clauses 29 to 33, which introduce a two-step verification process for the sale and delivery of knives and crossbows purchased online. Those provisions apply where a knife, crossbow or part of a crossbow is being delivered to a residential address. Yes, happy to.
Could I thank the Minister very much for giving way and congratulate her both on the bill as it stands but the amendments that are being made today. Near my constituency there's been a troubling spate of recent incidents where younger people, in some case encouraged by older men, are filming themselves catapulting wildlife, doing damage to that wildlife and then placing that footage on TikTok. The footage is deeply unpleasant. I don't recommend anybody looks at it. Would my honourable friend, the Minister, agree that that behaviour goes well beyond antisocial behaviour and may at some point require a ban on the use of catapults, generally, perhaps the sale of catapults, but certainly for that purpose?
Sadly, that's not the first time that I've heard about such appalling behaviour, attacking, injuring animals using catapults, and I'm certainly raising that with my counterparts in DEFRA to see what more we might be able to do, but I'm certainly aware that this is something that does need to be looked at, so I'd like to thank my honourable friend for raising that. I just wanted to return to amendments 24 to 33, which will require operators of collection points for items, knives and crossbows, as we were just discussing, to carry out the same enhanced age verification checks before handing over knives to the buyer, or in the case of crossbows or crossbow parts, to the buyer or even the hirer of the item. This is in the same way that clause 30 of the bill imposes the similar requirements on couriers. Clause 103 introduces costs and expenses protections for law enforcement agencies in civil recovery proceedings under the Proceeds of Crime Act 2002 in the High Court or in Scotland, the Court of Session. As currently drafted, it is not clear how the cost protections measures applies to pre-existing cases, particularly where cases have started before the provisions came into force, but costs are incurred after the provisions came into force. As a result, it may be difficult and costly to determine which costs are covered. Amendment 89 provides the cost protections apply to any case where proceedings start after the measures comes into force. Turning to confiscation, Schedule 15 to the bill introduces reforms to the confiscation regime in England and Wales in respect of the proceeds of crime. Amongst other things, the reforms makes provision for the provisional discharge of confiscation orders made under the Proceeds of Crime Act 2002, allowing outstanding confiscation orders to be placed in abeyance where there is no realistic prospect of recovery in the immediate term, and all enforcement steps have been exhausted. Amendments to Schedule 15 extend the provisional discharge measures to confiscation orders made under legislation, as I've just said, predating the 2002 Act. And I want to now turn to youth diversion orders. Chapter 1 of Part 14 of the bill provides for youth diversion orders, YDOs, a new counter-terrorism risk management tool for young people who, on the balance of probabilities, the court assesses to have committed a terrorism offence, an offence with a terrorism connection, or engaged in conduct likely to facilitate a terrorism offence, and the court considers it necessary to make the order for the purposes of protecting the public from terrorism or serious harm. The amendments to Clause 139 make a change to the scope of YDOs to ensure that applications can be made for individuals up to and including 21-year-olds. Currently, a court may make a YDO in respect of a person aged 10 to 21, but exclusive of 21-year-olds. Following further engagement with operational partners on the types of cases that could benefit from a YDO, we have concluded that this change would increase the operational utility of the YDO and ensure that it can be considered as an intervention in a wider variety of cases involving young people. Clause 1412 enables a YDO to include prohibitions or requirements relating to the respondent's possession or use of electronic devices. The amendment to this clause sets out a non-exhaustive list of some of the most common or most intrusive requirements that might be imposed to support the police's ability to monitor compliance with restrictions on electronic devices, providing a clearer statutory footing for imposing such requirements. For example, this would allow the court to impose a requirement on someone subject to a YDO to enable the police to access their device for the purposes of checking compliance with restrictions, such as accessing specific websites or applications. This would allow the police to identify harmful online activity at an earlier stage and intervene before it escalates. As with other YDO measures, the court would need to assess that any monitoring requirements were necessary and proportionate for the purposes of protecting the public from a risk of terrorism or serious harm. Technical amendments are also required to clauses 142 and 150 relating respectively to the definitions of police detention for Scotland and Northern Ireland and to the appeals process in Northern Ireland. The amendments will adapt the relevant provisions for the purposes of the law in Scotland and in Northern Ireland. The amendments to Clause 151 provide that where a person ceases to have a reasonable excuse for failing to comply with notification requirements but continues to fail to comply, they then commit an offence. Madam Deputy Speaker, the other government amendments in this group make necessary refinements to existing provisions in the bill and were detailed in the letter that I sent last week to the Honourable Member for Stockton West, a copy of which has been placed in the library. So with your permission, I will seek to respond to the non-government amendments in this group when winding up, and for now I commend the government amendments to the House.
Offence of trespassing with intent to commit criminal offence.
The question is that new clause 52 be read a second time. Call the Shadow Minister, Matt Vickers.
Thank you, Madam Deputy Speaker. Listening to the Minister's comments, I'd like to express my appreciation to all those who've worked on this legislation, developing and shaping these policies, whether that be the majority developed under the last Conservative government or the members of the Bill team who I'm sure have provided helpful assistance to ministers. As I'm sure we'll hear today, some of this legislation is as a direct result of amazing people who've suffered the worst experiences and have worked to ensure others don't have to in the future. Additionally, considering the context of the legislation, it's right to pay tribute to the excellent work of police officers across the country. Week in, week out, those serving in our police forces put themselves in harm's way to keep our streets safe. Those who serve and place themselves in danger cannot be thanked enough. Many people ask whether they would have the bravery to stand up and intervene. Officers across the country do so on a daily basis. Thanks to the last Conservative government efforts, the police force numbered over 149,000 officers in 2024, with 149,769 recorded in March 2024. This was the highest number of officers on both a full-time equivalent and headcount basis since comparable records began in March 2003. There are meaningful and important measures.
I'm really grateful to my honourable friend and the Minister for setting out those policing numbers. Does he share with me, though, my concern that when it comes to the additional police officers that we are getting, when I look at our figures for the West Midlands, the boost is coming from deployments. So I do worry where they're actually coming from and just how much of an increase we are really going to see.
Hello, Minister.
Yeah, I wholeheartedly agree. I think there's lots of concerns about the neighbourhood policing guarantee and where it's coming from, where that resource comes from, whether it's specials and volunteers. Of course, we want to see more of them. Whether it's redeploying people. People want to know when they ring 999 that they're going to get the response that they expected before. They don't want to see that depleted. To move officers from one bucket to the next, it has real consequences. And the biggest hit on our police force numbers at the moment will be that national insurance rise, that tax that's taxing police off our streets. The chair of the National...
I thank the Shadow Minister for giving way. I think we probably disagree on many things, but he's given a very well-presented speech. Would he not recognise, however, that there may well be an increase in numbers of policing, but we've seen a decrease in police staff. In Essex, we lost over 400 police staff during the Conservative period in office, and a number of police officers have been redeployed to be in roles that actually could have been done by police staff.
Matt Vickers.
Well, I'm glad to see all these police officers getting the proper training through his maths teaching and what have you, and glad to see he's got new recruits in his part of the world. But people are concerned about the frontline numbers. The numbers of police on our streets is a huge concern to the public. The figure that's coming out now, so the chair of the National Police Chiefs Council has said that the funding will not match the government's ambitions and fall short of maintaining the existing workforce. Just listen to the Police Federation, who stated quite simply, this Chancellor hasn't listened to police officers. Can the Minister confirm that by the end of this Parliament there will be more police officers than were serving in March 2024? I will.
Minister for giving way. He will know from our time on the Bill Committee as an ex-police officer myself, and I thank him for his words earlier about the police officers serving the country. Does he agree that this bill, once passed hopefully, actually gives the police more confidence that their powers are actually going to give them the right powers so they're able to have a difference?
I think, you know what, I welcome lots of the measures in the bill. I'm hoping that they're going to really help our police officers in keeping those streets safe, but they do need that resource, they need that funding, they need that support to be out there and enforce some of the legislation that we're putting forward today. And I thank him for his service on the Bill Committee as well as in the police force. Both today and tomorrow the House will debate a number of amendments and new clauses. Our opposition amendments are sensible ones aimed at improving the bill that our constituents would want us to get behind. Amendment 175 relates to the government's objective, which we all want to see it achieve, of reducing knife crime by 50%. We know the untold damage knife crime causes to victims, families and communities across the country. The legislation introduces a new offence, possession of an article with a blade or point or an offensive weapon with the intent to use unlawful violence. Let's put this in context. Imagine you're at home, in your garden, enjoying a nice peaceful afternoon with the kids. Suddenly our hard-working police officers swoop in on a man walking down the street, a man carrying a knife or offensive weapon who is then proven beyond all reasonable doubt to have planned to use it for violence. He could have been coming for your neighbours, your friends or your family. This is a man who clearly needs to be locked up. Would you want to see him put away for 4 years or 14 years? Or in fact, with the sentence in review, whatever he's sentenced to, he's likely to serve significantly less. Who knows how much of that 4 years he would serve before he could walk back down your street. But don't just take it from me that this is a more appropriate and fitting sentence. Take it from the professional that the government put in charge of assessing legislation relating to terrorism. Jonathan Hall, KC, independent reviewer of terror legislation, has looked at the horrific incident in Southport. He supports the creation of this offence, but has said that the penalty appears too low. Knife crime has devastating consequences for our communities. Increasing the penalty to 14 years would send a clear and unequivocal message that such dangerous behaviour will not be tolerated, and that those who pose a risk to the public will face the most severe of consequences. I urge members to support this amendment. Now I want to refer to the issue of fly tipping. People across the country are rightly furious to see tossers and fly tippers dumping waste in our streets and green spaces. They're all too aware of the impact on our environment, wildlife and the ability of others to enjoy communal areas. Amendment 174 recognises the scourge that littering and fly tipping represent across the country. According to figures compiled by DEFRA, in the 23-24 year, local authorities in England dealt with 1.15 million incidents of fly tipping and are estimated to spend more than £11 million of taxpayers' money cleaning it up each year. That money could be better spent on frontline services, such as... Bradley.
My honourable friend, just to further that point, when it comes to the cost of litter and fly tipping, littering, according to Keep Britain Tidy, is costing the country £1 million a year. Again, that is money, does he agree, that could go on to frontline services. So it's about time we took some harsher or more stringent measures to change behaviour and some good enforcement.
I couldn't agree more. Small minority who wreak havoc on our countryside, on our streets, and create absolute chaos. That's what this amendment's about. It's about tougher sanctions to divert those people from doing such mindless things. That money could be better spent. The money that is wasted every year clean up could be better spent on those frontline services, filling potholes, providing community services. Instead, it's used to clean up after those who have no respect for others or for our natural environment. The most common location for fly tipping was on pavements and roads, which accounted for 37% of all incidents in 23-24. The majority of these involved small, van-sized dumps or an amount of waste that could easily fit in a car boot, 59%. It's therefore logical to conclude that a significant majority of fly tipping incidents stem from vehicles. Using a vehicle to dump a van full or a boot full of waste should come with real consequences, and they should feel that in their ability to use their vehicle, as well as through financial penalties. The last government increased fines for fly tipping from £400 to £1,000, but we can go further to deter people from dumping on the doorsteps of others. This amendment would require the Home Secretary to consult on the establishment of a scheme of driving licence penalty points for fly tippers and those who toss rubbish from vehicles. During the Bill Committee, the Minister pledged to engage with DEFRA on this issue. Today, by passing this amendment, we could go further than that, committing to undertake a consultation to develop a workable and effective scheme for the benefit of all those who want to be able to enjoy their green spaces, for our environment and the wildlife that suffers at the hands of fly tippers and those who toss waste. I urge members to support this amendment. Let's send a message to the mindless minority who wreak havoc on our green spaces. Before concluding my remarks, I'd also like to draw the House's attention to Amendments 167, 168, 170 and 171, which, among other Conservative proposals, aim to strengthen respect orders. We've heard the Minister speak, both in committee and in the Chamber, of the role these orders can play in tackling antisocial behaviour. The success of this policy will be contingent upon effective enforcement by the police and on perpetrators' knowledge that they will face tough sanctions if they breach these. I hope the Government will continue to consider these as we move forwards. I draw members' attention to these amendments as they're indicative of the constructive approach that members on this side of the House have taken towards improving this bill, in ways that we believe will benefit and improve the legislation as a whole. I hope members across the House will give serious consideration to the proposed amendments and new clauses over the coming 2 days. The Minister and I have spent more time together than she ever likely envisaged, and I believe we can both agree that there are some sensible and proportionate measures in this bill. Greater protections for our retail workers, efforts to tackle antisocial behaviour, and more measures to tackle vile and horrendous child exploitation. But we can work together to go further, and that's what our opposition amendments seek to do. Thank you.
Sam Carling.
Thank you very much, Madam Deputy Speaker. And may I begin by again welcoming this bill. It will deliver so much for my constituents in relation to protecting people from crime and enabling tough action on antisocial behaviour, including areas which have for too long been labelled low level and ignored, like the illegal and off-road bikes, which my constituents so often raise with me. And it will introduce mandatory reporting for child sexual abuse, one of the key recommendations from the independent inquiry into child sexual abuse, which I'll abbreviate as ICSA for the remainder of this speech. That is a long overdue measure and one long called for by our Labour Home Secretary and the Prime Minister personally. However, I remain concerned that the government is not going far enough on the issue of mandatory reporting, and that is why I have laid 3 amendments to the bill on that subject, numbered 10, 11 and 22, which my speech today will focus on. These are not intended to change government policy, quite the opposite. These amendments are intended to deliver the government's stated policy, to implement the ICSA recommendations relevant to the Home Office in full. The Home Secretary stated in January that this was the government's intention. And she reaffirmed that just yesterday, actually, in response to my question on her statement, with a firm yes, after I asked if it remained her policy to implement them in full. But there are 3 significant gaps in our plans to implement Recommendation 13 on mandatory reporting, where the bill is not delivering what ICSA recommended. With these gaps, I am concerned that the duty to report will be ineffective in some of the settings where it is most needed, religious groups in particular, and I will use the example of the Jehovah's Witnesses, the religious group which I grew up in, to illustrate how and why. They have a deep cultural distrust of secular authorities, and that leads to a culture of dealing with everything internally, as happens in a lot of different religious groups, including child sexual abuse, and reporting nothing to the police. Furthermore, their internal processes for doing so are atrocious. For example, there's something called the 2-witness rule, which means they take no action on any report of wrongdoing unless there are 2 witnesses to it. There are never 2 witnesses to child sexual abuse. I give this context to highlight why the mandatory duty to report must be absolutely watertight, as ICSA recommended, to prevent people in leadership organisations, or in leadership of organisations like this, from avoiding it. So I'll come to the 3 gaps in turn. Firstly, there are no criminal sanctions if you don't comply with the duty. I understand that the government is proposing professional sanctions, i.e. a referral to the Disclosure and Barring Service and to relevant professional regulators, but that's not actually on the face of the bill, and it would only apply to a fraction of people under the duty. It would not, for example, do much in religious settings, where so many of the failings are happening and where the duty would, if constructed properly, immensely help to protect children. ICSA were clear that failure to comply should be a criminal offence. My Amendment 10 makes this the case and proposes a fine as the appropriate sanction, which is in line with best practice overseas. Because many other countries, France, Australia, parts of Canada and so on, have introduced mandatory reporting, and many have done so with criminal sanctions of this kind. And while the government will likely say that criminal sanctions could have a chilling effect that stops people going into professions that work with children, the international evidence clearly shows that this does not happen. In the Australian state of Victoria, for example, and Professor Ben Matthews has done some extensive research on mandatory reporting laws and their efficacy, which I thoroughly encourage the Minister to ask officials to examine. The second gap relates to who actually comes under the duty to report. ICSA recommended that it should apply to anyone working, firstly, in regulated activities with children under the Safeguarding and Vulnerable Groups Act 2006. The bill uses that criterion tick. But ICSA then also recommends that it should apply to anyone in a position of trust over a child as defined by the Sexual Offences Act 2003. And that's what the bill does not include. My Amendment 22 would make it so. At the moment, the bill instead creates a list of relevant activities in Part 2 of Schedule 8, which replicates about 90% of what is in the Sexual Offences Act. But that missing 10% is critical. It includes sports coaches and teachers, for a start, which our schedule does not. And to go back to my example, the Sexual Offences Act includes a very effective definition of religious leaders in Section 22A. We have put a definition of religious leaders into our schedule in this bill, but it requires them to have, and I quote, regular unsupervised contact with children to be subject to the duty. That will allow virtually any religious leader, be they paid clergy or a volunteer elder, like in the Jehovah's Witnesses, to escape the duty, as very few have regular unsupervised contact with children, despite being in a very significant position of power and influence. And I personally happen to know at least one person who actually was sexually abused as a child in that organisation. They went to speak to religious elders about it in the presence of their parents, and not unsupervised, and they were advised that to go to the police would mean bringing reproach on God's name. So no report was made, either by the victim, their family, or those religious elders. This is commonplace. And under the bill as currently drafted, there's no sanction for that. The elders aren't mandated reporters, and even if they were, the proposed offence under clause 73 around stopping someone else from making a report, which I very much welcome for the record, only applies to other mandated reporters. So if someone pressures a victim, or their parents for example, not to make a report, that won't be illegal. So that offence needs to be broadened too, and I know the NSPCC are calling for the government to consider a broader offence of concealing child sexual abuse, which I urge the government to give serious consideration to, and I may give some more detail on that later if there's time. I will give way.
Cameron Thomas.
I thank the honourable member for giving way. He's making very important points about, particularly about the Jehovah's Witness cult. And one of the methods that they use to ensure that issues like this don't escape from the organisation itself is the act of disfellowship, where an individual is threatened by being disfellowshipped all communication with their own family. And I wonder if he'll go a little further into recognising that too. Thank you.
Sam Carling.
I absolutely will, and I very much thank the honourable member for that intervention. I'm very pleased that other honourable members in the House are aware of that issue. It's something I am trying to do some work on separately. I think it's not... It is certainly relevant to what I'm discussing here. Just to give the House a little more context on that, what that essentially means is if that organisation decides that someone has committed a serious sin, it can essentially tell all of their family and friends to cut them off permanently. The same applies if they just choose to leave the religion. But very rarely is that applied to perpetrators of crimes, and more often to victims that report them. And it is an enormous problem that has to be dealt with, and I look forward to engaging with the honourable member further on that. So, the Australian Royal Commission, which investigated this organisation's handling of abuse cases, as I highlighted at second reading, found that allegations had been documented by religious elders against 1,006 individuals in Australia alone, and not a single one was reported to police. So we must tighten up this definition and make sure it includes religious leaders. The government could do that by amending our definition in item 17 of part 2 of schedule 4, and also adding a further item to the list in relation to sports professionals to deal with that point as well. But the much neater and stronger legislative solution would be to just do what ICSA said and refer to the Sexual Offences Act 2003 and the definition therein. And as I said, my Amendment 22 proposes to do this. The third problem relates to what actually triggers the duty to report. ICSA recommend that it should apply in 3 cases. 1. A mandated reporter is told by a child or perpetrator that abuse has taken place. 2. They see it happening. Or 3. They observe recognised indicators of child sexual abuse, which can range from something like a child that is pregnant or has a sexually transmitted infection to other more subjective indicators. Our bill scores 2 out of 3. It does not include the third point, recognised indicators, also referred to as reasonable suspicion. And overwhelmingly, children do not report abuse that is being done to them at the time it is happening. Those that do report tend to do so years after it happens and when it is far too late to protect them, and far too late in many cases to catch the perpetrator and stop them harming other children. And that Australian Royal Commission again in 2015 found that the average time for someone to disclose child sexual abuse was 22 years after it happened. So including reasonable suspicion is critical here. And that is what my Amendment 11 does. And given the potentially subjective judgments needed in that case, Amendment 11 does exempt the case of recognised indicators from criminal sanctions for non-compliance, which is what ICSA recommended too. The government may be of the view that including recognised indicators and making my proposed changes to include positions of trust more thoroughly will lead to a flood of additional reports that will overwhelm the system with false leads that prevent real cases of abuse being tackled. These are very, very reasonable concerns, and I hear them. But again, we must look to the international examples where this just has not taken place. In Australia, there was an increase in cases after they brought in robust mandatory reporting laws, but the system adapted and coped, and existing screening processes were reworked to remove false reports more effectively. And notably, the number of substantiated reports made doubled, meaning that twice as many sexually abused children were being identified. This is making a huge difference. And we don't even have to go international to see that fears about floods of reports just do not materialise. We just have to go to Northern Ireland, which already has mandatory reporting for all adults, with criminal sanctions for non-compliance, as part of their broader legislation requiring the reporting of arrestable offences to police. And there's no overwhelming flood of reports going on over there. I urge the government to take these problems seriously. As I said at the outset, the Home Secretary has reaffirmed several times that government policy is to implement ICSA's recommendations, which fall under the remit of the Home Office, in full. I know the government will need to reflect on these issues. I'm going to press these amendments to votes today should the Minister not accept them, but colleagues in the other place, I'm aware, will press these amendments. A number of honourable members have signed them, with 12 signatures on Amendment 22, for example, so there is a significant fear that without these changes, the proposed mandatory reporting duty is too weak. We all want to get this right, but the impact assessment on a very similar version in the last government's criminal justice bill was damning, predicting only a very small increase in the number of reports. If I may just conclude very briefly by returning to what I mentioned earlier around a potential offence for concealing child sexual abuse. I looked at how to put this in as an amendment to broaden discussion, but it was very difficult to phrase in the correct way. Essentially, the NSPCC have highlighted a number of cases where they are arguing our bill does not go far enough to cover the multitude of ways which reports of abuse can be concealed and could allow people who intentionally conceal this crime to slip through the net. ICSA found a number of cases where they believed that actually a lack of reporting had bordered on concealment. And as a couple of examples, we can imagine that Clause 73 as currently drafted means that a senior leader of an organisation who chooses to simply move on an employee they suspect of committing child sexual abuse, rather than ensuring they are reported to the authorities, may not be caught under the offence around preventing someone else from reporting, if their actions do not actively prevent or deter that reporting explicitly. And other actions could include communities, institutions or authorities destroying evidence of historical child sexual abuse to prevent it being reinvestigated, or in some other way hampering or impinging upon investigations that are taking place, or someone burying evidence of child sexual abuse after it's been reported to the authorities so it can't be properly investigated. And this bill provides us with a really strong opportunity, I hope, to deal with some of those issues, and I hope the government will look at that as the bill moves through the other place. So thank you very much to Andrew Speaker for calling me, to the House for listening to that, and I very much hope that the government will continue to work and look at these issues in more detail so that we can find an acceptable solution.
Yeah. Liberal Democrat spokesperson Lisa Smart.
Yeah. Thank you very much indeed, Madam Deputy Speaker. I rise to speak to Amendment 160 in my name and briefly in favour of Amendments 157 and 158 also in my name. But I want to start by thanking all of those who have campaigned over many years for some of the really sensible changes in the law that we're discussing today. I also want to put on record my thanks to our fantastic police forces, including my own GMP, and also to my honourable friends, the members for Frome and East Somerset and Sutton and Cheam for their assiduous work on the Bill Committee. Liberal Democrat Amendment 160 ensures that police cannot use live facial recognition technology when imposing conditions on public assemblies or processions under sections 12 or 14 of the bill, unless a new specific code of practice governing its use in public spaces has first been approved by both houses. Regulations around the use of live facial recognition have been discussed many times in this House, and support for strengthening the current situation, bringing clarity and certainty to police forces has gained support from all sides of the House, both in this chamber and in Westminster Hall, and I hope this amendment does the same today. Liberal Democrats oppose the police's use of facial recognition surveillance. We believe it breaches the right to privacy, is far too often biased, particularly given its propensity to wrongly identify people of colour and women. And in our manifesto last year, we committed to immediately halting the use of live facial recognition surveillance by the police and by private companies. In all cases where police use data or technologies like AI, we believe their use must be regulated to ensure that it's unbiased and that it's used in a way that's transparent and accurate, and it respects the privacy of innocent people. Policing should not intrude on this right for people who are not suspected of any crime. And on the question of bias, much of the recent debate has centred around the National Physical Laboratories 2023 study into the equitability of facial recognition technology in law enforcement. This report is frequently cited by proponents of facial recognition, including the Shadow Home Secretary, both at the dispatch box when the bill came before the House at second reading and during a very well-attended Westminster Hall debate last November, as evidence that bias in the technology is on the decline. But we should not overlook one of that study's most critical findings. In live facial recognition, where a real-time camera feed is compared against a predetermined watch list, the likelihood of false positives is not fixed. Instead, it depends heavily on the specific parameters of how that technology is deployed, particularly the face match threshold. That threshold, in turn, is influenced by both the size and composition of the watch list, as well as the volume and nature of the people moving through the surveillance zone. The study recommends, where operationally feasible, that police use a face match threshold of 0.6 to reduce the risk of bias. However, and this is crucial, without clear regulation, police forces are under no obligation to adopt this or any specific standard. In other words, the presence of the technology alone does not ensure fairness. Without oversight, significant room remains for bias to persist in how facial recognition is applied. This leads to increased instances of the wrong people being stopped and searched, an area of policing that already disproportionately impacts black communities. New technologies in policing may well present good opportunities to improve public safety, and police should take advantage of them to prevent and solve crime. However, given that new technologies can raise significant concerns related to civil liberties and discrimination, we must ensure that any new powers involving them are scrutinised by both houses. Liberal Democrat Amendment 160 ensures that the police cannot use live facial recognition technology when imposing conditions on public assemblies or processions under sections 12 or 14 of the bill, unless a new specific code of practice governing its use in public spaces has first been approved by both houses. This will ensure democratic oversight of any changes to further legislation that may impact public privacy and civil liberties, and I really hope it gets support from across the House. And then just a few words, Madam Deputy Speaker, regarding Amendments 157 and 158 in my name, which would enable a review of antisocial behaviour powers. Antisocial behaviour, as members from across the House have already mentioned this afternoon, it blights communities, it erodes trust, frays the social fabric, and disproportionately affects the most vulnerable. Many colleagues have raised issues within their own communities, and I see it in my own constituency. We've got off-road bikes, an absolute blight in Heatherley, in Marple, in Offerton, High Lane. They are a persistent blight on my community. They intimidate people, they endanger public safety, and they are just really annoying. But we must respond with laws that are not just tough, but fair and proportionate, and that's why I urge all colleagues to support Amendments 157 and 158, which ensure that antisocial behaviour laws are reviewed before being changed, and that any new guidance that's created is created with public input. I'd also like to welcome Amendment 3 in the name of my honourable friend, the Member for Wells and Mendip Hills, which aims to ensure the duty to report suspected child abuse covers faith groups. And I would really encourage the Member for North West Cambridgeshire to seek her out, for he will find a doughty ally in his attempts to improve the bill as it impacts on faith groups. And as I said, Madam Deputy Speaker, when this bill came before the House for second reading, there are measures within it that we Liberal Democrats support. And with the amendments we are putting forward today, we feel it would go even further and even closer to keeping our communities safe in a way that's proportionate and balances the civil liberties implications of giving more powers to the police. I hope they're supported across the House.
Kira Whistle.
Thank you, Madam Deputy Speaker. I rise to support the bill and to speak to Amendment 20 tabled in my name and supported by more than 50 members from across the House. The measures in this bill represent the most significant package of crime prevention and policing reforms in a generation. From strengthening action against shoplifting, knife crime and antisocial behaviour to introducing new powers to confront child sexual abuse, this legislation gives our police the tools they need to take back our high streets and town centres. I am proud to support this bill and proud that this Labour government is showing leadership by putting victims first, supporting our police and turning the tide on crime after 14 years of Conservative neglect. It is in that same spirit, Madam Deputy Speaker, of placing victims at the heart of our justice system that I tabled Amendment 20. It raises an urgent and under-recognised issue, the devastating link between domestic abuse and suicide, and the failure of our legal system to properly reflect it. This amendment is supported by Southall Black Sisters, a pioneering black feminist organisation founded in 1979, dedicated to empowering black, minoritised and migrant women and girls, particularly those fleeing violence. For over 4 decades, Southall Black Sisters has been a trailblazer in advocating for the rights and safety of some of society's most marginalised women and girls, and addressing barriers rooted in racism, sexism and socio-economic inequalities. Their mission is to dismantle the structural injustices harming black, minoritised and migrant women and girls, whilst fostering global solidarity for a future rooted in equity, justice and empowerment. I sincerely thank the dedicated staff members at Southall Black Sisters for their help with my amendment. Too often, those who drive their victims to suicide through sustained coercion, violence or psychological abuse walk away without consequence. While the bill introduces welcome offences around serious self-harm, it still falls short of recognising the full impact faced by victims of domestic abuse, particularly when it ends in suicide. The statistics should stop us in our tracks. According to the Vulnerability, Knowledge and Practice programme, suspected suicide linked to domestic abuse now outnumber domestic homicides. It is estimated that 3 women die by suicide every week as a result of abuse. And yet, since 2017, there has been just 1 conviction where a victim's suicide was legally recognised as the outcome of domestic abuse. 1. That is not justice, it is a failure to see these women, to recognise what they've endured, and to hold their abusers to account. Coercive control and psychological torment may leave no bruises, but their impact is every bit as lethal. And when domestic abuse ends in suicide, it must be recognised for what it is, a crime. The injustice of this issue falls heaviest on those already most marginalised. Black, minoritised and migrant women face the highest barriers to safety, barriers rooted in racism, immigration insecurity, stigma and a lack of culturally competent services. Too often they are misjudged, criminalised or simply ignored. The justice system and indeed society must stop asking, why didn't she leave? And start asking, why wasn't he stopped? That is the change Amendment 20 calls for. It shines a light on these deaths and makes clear that when abuse leads to suicide, the law must see it, hear it and respond. I am pleased that through this bill, the government are taking forward meaningful changes to deliver on Labour's mission to halve violence against women and girls. Madam Deputy Speaker, I do not intend to press my amendment to a vote, but I hope the government will bring forward changes that recognise the link between abuse and suicide and ensure our laws reflect that reality. In France, for example, the law was changed in 2020 to recognise suicide or attempted suicide as an outcome of domestic abuse. A perpetrator may now face up to 10 years in prison and a substantial fine if abuse is found to have significantly contributed to the victim's death. That is a level of seriousness this issue should demand. Madam Deputy Speaker, I am grateful for the Minister for Victims for meeting with me to discuss the issues my amendment raises, and I welcome the Minister's invitation to submit evidence to the forthcoming Law Commission review. I also welcome the Minister's recognition that current homicide laws do not adequately reflect these cases. Madam Deputy Speaker, I fully support the bill's mission to protect victims and restore trust in our justice system, but that justice must be complete. The women driven to take their own lives by abuse must no longer be invisible to the law. Madam Deputy Speaker, in short, Amendment 20 criminalises abusers who drive victims to self-harm or suicide by introducing a new offence of encouraging serious self-harm or suicides following a sustained pattern of abuse. The bill introduces new offences for encouraging or assisting self-harm, but falls short of covering cases where victims die by suicide following sustained patterns of coercive control and abuse. Recognising this form of abuse in law is critical. It would reflect the severe psychological impact of coercive control, enhance deterrence, and increase survivor and public confidence in the criminal justice system. It would also compel judges, juries, coroners and police to properly investigate and respond to such cases, treating them with the seriousness that they deserve. Ultimately, it ensures that victims are not failed by a legal framework that continues to overlook long-term and often fatal results of domestic abuse.
Joe Robertson.
Thank you, Madam Deputy Speaker. I rise in support of my amendment number 19 to this bill. Amendment number 19 seeks to amend clause 94, which brings in a new law to make spiking or administering a harmful substance an offence. I'm grateful for cross-party support I have received for this amendment from MPs in Labour, Conservative, Liberal Democrat, Green and Independent. The intended law around spiking is a sound one, and it generally has cross-party support. Indeed, it was in a previous version of this bill under the previous government. My concern is that it has a defect, there is a loophole in the law, and my amendment seeks to close that by ensuring that spiking by a reckless act is also an offence. Spiking is a hideous, heinous activity that destroys lives. It destroys people's physical health, it destroys their mental health, and at worst, it kills people. The majority of victims of spiking are women, 74%. The average age of those being spiked is just 26. But there is no typical spiking incident. The majority involve putting something in a drink, but needle spiking is also on the rise. The most likely place for it to happen is in a bar, a pub or a club, but it can happen anywhere, including in a supermarket or on the street. So the motivations behind spiking are probably most commonly thought amongst members of the public to be motivated by sexual intent or motivated to facilitate a theft. But at Bill Committee, we heard from Colin Mackey from SpikeAware of a very different type of spiking. And it's this that I think the new law fails to address. That is the rise in spiking that seems to have no particular intent behind it. It's sometimes referred to as prank spiking. Spiking for, and I quote the government's own guidance, seemingly a bit of fun. And we heard from Colin Mackey about how his son, Greg, died through suspected spiking of this kind. Now, what this bill does is criminalises spiking with intent or administering a harmful substance with intent to injure, aggrieve, or annoy. I do not accept that every case of spiking fits into that definition. Now, I give an example of a scenario where recklessness would cover it. And by the way, I should just say recklessness is a well-trodden principle in the criminal law, dating back over 200 years. It is an alternative to intent, so that if the defence establish that someone meant to do something, it can alternatively establish that their actions were so reckless they should be convicted. An example being assault causing actual bodily harm. The prosecution must establish the harm, but it can either establish that someone intended that harm or they did an act so reckless that harm was bound to follow. And it doesn't matter which they establish to a jury, they will secure a conviction. The same with manslaughter. The prosecution can run a case that, although somebody didn't intend for someone else to die, their actions were so reckless They should have known somebody might die, and they secure a conviction. And by the way, in the absence of this spiking law, those two offences are often used, but are often defective in themselves. And that's why the government's bringing its own spiking law. But it's failed to replicate the principle of recklessness within it. I give an example, Madam Deputy Speaker, a hypothetical one. A group of friends go into a bar. Two of them have been taking illegal drugs. It's something they've done before. They are enjoying themselves. And they say to each other, that friend in our group, in our circle with us, he needs to loosen up some more. He needs to stop his ridiculous opposition to just having a bit of fun by taking these pills. I'll tell you what, we'll do him a favour. Let's not tell him, these pills we've been taking, let's slip one in his drink so he can loosen up and enjoy the evening like we are. They go ahead and do that, and of course their friend very likely is harmed. He may not have have done that drug before. He may be taking prescription drugs, and the mixture is a cocktail. When those two people are taken to trial, of course I'm sure this House would intend that they have committed a crime. But I can see a scenario where their defence will say, members of the jury, my clients were foolish. They were silly. They shouldn't have done it. But they didn't intend to annoy their friend. They didn't intend to injure their friend. What they intended to do was have a bit of fun and help him have a bit of fun. And it was stupid, but they didn't intend it. How is a jury supposed to convict beyond reasonable doubt on that? Instead, if the prosecution were able to come back and point to recklessness, they would be able to say, we do not care, members of the jury, whether those two people intended giving their friend would be fun for that friend. It was so obviously reckless. It was so obviously reckless to any reasonable person that it must be a crime and you must convict. I think that is a much more wide-ranging, all-encompassing, tried and tested legal principle that Clause 94 needs in it, and my amendment does just that. And I would like to thank Colin Mackey from Spike Away UK for bringing this evidence to Bill Committee, and to Stamp Out Spiking, who have also done a huge amount, and to members actually who are no longer in this place, who've been doing a lot of work behind the scenes. I'll take an intervention.
I'm very grateful to my honourable friend. I'm not a lawyer, but he's deployed a very clear and compelling argument. He referenced at the beginning of his remarks, Madam Deputy Speaker, that this amendment, of which I'm a signatory as well, is commanding cross-party support. Is he able to indicate, in advance of anything which the Minister may say, but in conversations he's had with the Home Office and individual ministers, the government's response to this? Because he seems to be making such a compelling case that it would be helpful if the government accepted it.
I thank my honourable friend. I was on the Bill Committee where a similar motion was put, so I can reference the Minister's response at that time, and I have had a brief word with the Minister outside this place. The government's position seems to be that the type of activity I'm describing is covered elsewhere. It's covered in that intent to annoy. But I hope I've made it perfectly clear that all reckless acts are plainly not covered by an intention to annoy. And I am concerned. I don't for 1 minute suggest the government are willfully not wanting this law to work and to cover all scenarios. But I am left with the impression they have not sufficiently addressed their mind to this gaping loophole that's staring them in the face. And I would urge them to come forward, and if they don't like my amendment, make an amendment of their own to deal with the issue. Because if just one person walks free following this law because they were able to convict, they were able to convince a jury that their actions were not annoying but would have been reckless, then it's a terrible failure of what this government is trying to do in this bill. And I would urge the Minister to think again, and I would urge all across this House to vote for this amendment to force the government's hand.
John McDonnell.
Thank you, Madam Deputy Speaker. I've tabled amendments with 161 with regard to the issues around public order and the policing of demonstrations. But before that, can I welcome in the bill the proposals on fly tipping, and I look forward to the guidance that will be issued to the various authorities to deal with the fly tipping issue. I'm attracted by the amendments moved by the opposition as well for inclusion in that guidance, largely because, like other members, my constituency is plagued with fly tipping, and I seem to be followed by a mattress throughout my constituency on virtually every area I visit. If I come on to the public order, my amendment is 161, and the reason I tabled this is really to try and get on record the reality of what's happening with regard to the public order issue with regard to demonstrations. In the explanatory notes, the government has set out the argument that the regular protests, and I read it, following the events in Israel and Gaza on 7th of October, highlighted gaps in public order legislation, Public Order Acts of 86 and 23. And these proposals have now been brought forward by the government in response to the policing challenges of such protests. Let me say, I've been on virtually every national demonstration in central London since the 7th of October, organised by the Palestine Solidarity Committee and other groups. And I understand the pressure that's on the police service. In fact, I have police constituents who've had their leave cancelled and all the rest because of the frequency of the protest, but the frequency of the protest is largely in response to the depth of concern about what's happening in Gaza, and people have wanted to express their view, and one of the ways through our democratic system is to demonstrate and march and protest. But on all the demonstrations I've been on, I think, one, they've been peaceful, they've been good-natured, and actually, and up until a few instances recently, I think extremely well policed. And what the government has set out in their notes is the reason new legislation has been brought forward is in the explanatory notes it relates to three things, which we can all agree on basically, which is the new criminal offence on climbing on war memorials. The other is the possession of a pyrotechnic article at a protest, which is dangerous anyway. And the other is concealing identity, although there's issues around the concealing of identity that is referred to in other amendments, because that might well have impact upon the religious freedoms, the exercise of religious freedoms, particularly with regard to the veil and being able to dress. What the government don't cite in these explanatory notes is the issue that's related in the clause 114, which is places of worship restriction on protests. In all the demonstrations that have taken place, the national demonstrations in London, there has never been an incident outside of a place of worship. There have been concerns expressed by some groups, but they're largely groups that I think have other motivations rather than concerns about public order. In fact, on the negotiations with the Metropolitan Police on each of the demonstrations that have taken place, there's a long discussion of identifying of routes, usually overall agreement on avoiding any areas that could be seen as contentious, that could provoke a reaction. And even where there are some instances where some distance away from the demonstration there might be a place of worship, for example a synagogue, the organisers have tried to ensure not just the proper stewarding so it doesn't go anywhere near them, and in fact we usually have a 10 or 15 minute distance of walking, but also that the timing of the services are avoided as well. And it's interesting that up until very recently there has never been a problem, but the the police recently seem to have hardened their attitude. Excuse me, and I think that's as a result of coming under pressure from some organisations that might simply not want the protests to go ahead in any way, in any form, because they take a different attitude to what's happening in Gaza and Palestine. If that water is for me, that would be extremely useful. Thank you very much. So I'm concerned that we're trying to solve a problem here that doesn't exist, but also could be solved in better ways. And I'm worried about the drafting of the legislation itself. And I just read the clause. It says, in the case of a procession, the procession is in the vicinity of a place of worship. We need to have clarity about what in the vicinity means. As I've said, in the last demonstration negotiations, the police were concerned about a synagogue. The protesters wanted to march to the BBC, and they were concerned about a synagogue which was 10 or 15 minutes walk away. And even then, the protest organisers said, fair enough, so we'll make sure it doesn't go anywhere near if there's a service going on, so no one feels in any way anxious about that. But the way the clause is defined at the moment, I think it leaves it open to interpretation, and the interpretation is often by police officers who come under intense pressure from people who might have different motivations than simply worried about public order. And the other issues in the clause, it say, may intimidate persons of reasonable firmness. I have no idea what reasonable firmness means. In fact, I've not seen this definition in legislation before, and it may well have occurred in court in setting precedents, but I've literally not seen it before. I have no idea what reasonable firmness is. In fact, I wouldn't be able to determine what members of this House standing of reasonable firmness is on any issue, because these matters change with time and with regard to particular circumstances. And what I'm worried about is that if this is left so loosely in the hands of police officers at the moment, I think the police officers themselves are almost put in an impossible position about these definitions and how they implement them. At the moment, for a long time, whilst the demonstrations have been going on, the police have tried to consult as best they can. But even there, and this demonstrates for me how contentious these issues can become. They've consulted with the Jewish communities, but there's real arguments within the Jewish community about who represents them. And on the Board of Deputies at the moment, who are normally consulted, the Board of Deputies represent an element of the Jewish community, but certainly not the majority. And the Board of Deputies is now split. You've had 38 members of the board contradict the position of the majority of the board. There are other religious groups, Jewish groups, have not been consulted or only recently have been consulted and expressed their concerns about the way the police are making these decisions. So the reason I put an amendment down to delete this clause because I wanted to just get on the record some of the facts around the issue, which is there have not been problems with regard to places of worship on any of the national demonstrations. There's a procedure for negotiating the routes and avoiding disturbance as much as possible, avoiding disturbance per se. That's worked pretty well up until very recently. And before legislation is produced like that, it needs a great deal more consultation, but consultation with a much wider community than is taking place at the moment. And I just think it leaves open these definitions of vicinity or reasonable firmness. I think actually opens us up now to a system which is more difficult to implement than the current negotiations that take place, which are taking place with an extremely, up until very recently, as I said, extremely atmosphere of goodwill. So I worry about this piece of legislation, and I hope that in the other place, if nothing else, we might get clearer definitions, or we might even get from the government in advance of that much more detailed guidance on how this is going to be implemented. Otherwise, I just think it will cause more divisions than it will settle some of the problems that some people perceive. And I actually do think that there's an agenda from some who simply want to stop the protests overall. And that would be, in my view, undermining of the democratic rights of people, but also would mean people will take action in different ways. And I would rather we channeled their concerns, yes, and sometimes their anger, into forms of protest that are manageable and at the same time can be used more constructively in the expression of people's views. So I'd urge the government between now and the House at the other place to think again about this particular clause, see whether or not the government itself could look to clarifying of some of these definitions, maybe bring forward guidance, and maybe halting the implementation of it until there's been a much thorough consultation with a wider section of the community than maybe is taking place at the moment. All of us want to see the democratic right of protest to be upheld. I've never heard anyone in this House argue against that. But we want to ensure that it is done in a way which doesn't cause harm to anyone, but doesn't deny that people's their democratic rights to express their opinions. And in this coming period, because of the heightened circumstances in international affairs at the moment, I think we'll see more demonstrations, and therefore it's important that we get the management of these demonstrations right through more effective legislation as proposed today. Thanks, Mr. Speaker.
Sian Berry.
Madam Deputy Speaker, I rise to propose my amendments 4, 5, 6, 7 and 8 on child criminal exploitation. And I also thank the honourable members for Hayes and Harlington and Isle of Wight East on both sides of the House for their speeches and proposals today. I also want to voice my particular support for Amendment 21 from the Honourable Member for Brent East to prevent driver licence information being obtained by the police which is obtained by the police for being used for intrusive facial recognition and biometrics. And Amendment 164 from the Honourable Member for Liverpool Riverside, which removes clause 108 and the ban on face coverings in protest situations. The Honourable Member for Clapham and Brixton Hill has also put down mitigating amendments on that subject. 184, creating exceptions, not just defences, for health, work and religious faith coverings. And Amendment 185 for an equalities review. I really hope the government will look at all of these. Today, I welcome the efforts in the Crime and Policing Bill to protect vulnerable children, and I particularly welcome the introduction of a new offence of child criminal exploitation, which will signal to perpetrators that coercing, manipulating and exploiting children into criminal activity is child abuse and will be treated as such. Criminals are exploiting thousands of
The Right Honourable Mark Carney, Prime Minister of Canada. Le Président honorable Mark Carney, Premier ministre du Canada. Mr. Mark Rutte, Secretary General of NATO. Monsieur Mark Rutte, Secrétaire Général de l'OTAN.
Mark, what a place you found here. What a backwater. Yeah. Absolutely, she's doing right. Oh, the same here. Up to the teeth. But it's good. And
Good to see you. C'est un grand plaisir d'accueillir le secrétaire général de l'OTAN, un des chefs les plus capables du monde, à un moment, à un point tournant pour l'OTAN, mais pour la paix et la sécurité de l'Ouest et en effet du monde. It is a great pleasure to welcome Secretary General Rutte. As I just said, one of the most experienced leaders in the world. We're very fortunate that he's taken on these responsibilities to lead NATO at this crucial time, not just for peace in Europe, peace across the alliance, and peace and security in the world. The summit next week will be essential to accomplish that. I want to compliment you on all the great work you've done in the run-up, and pleased that Canada is stepping up to meet our commitments, and look forward to defining those new responsibilities and capabilities.
Cher Mark, merci beaucoup. Thank you so much for this very warm welcome. And I'm really looking forward to the summit next week. But of course, first today, an important meeting this morning here in Canada, and in this G7, which you are chairing, I think, in an exemplary way. I really thank you for doing this and the leadership you provide. I also want to say that the fact that you decided to bring Canada to the 2% spending when it comes to NATO this year is really fantastic. And with Portugal having announced the 2% this year last week, that means that the whole of NATO will now be in 2025 at 2% before the summit starts next week in The Hague. So that is really great news. And your leadership here has been extremely important. And we know each other for so many years, so I really look forward to continue working together in whatever role you and I have. It's always great fun, and it is always great content. So thank you.
Very good. Thank you very much. Merci beaucoup. Thank you very much.
Thank you.
Excellent.
No, sorry. You
Stay down, right there.
You guys got you guys and pulse is good? Okay. We're good, sir. We're good?
Alors, bonjour tout le monde. C'est un grand honneur d'accueillir Monsieur le Président Zelensky d'ici à Kananaskis pour cette réunion très importante du G7. I would like to start by condemning in the strongest terms the latest outrage, barbarism from Russia, and express my deep condolences and those of the Canadian people to the families in Kyiv who were affected. This underscores the importance of standing in total solidarity with Ukraine, with the Ukrainian people, and we had a discussion last night among the G7 leaders. The President and I will discuss more, and then of course we'll have the direct discussion in a moment together. But we underscored the importance of using maximum pressure against Russia, who has refused to come to the table. The President has led unconditionally to come to the table in search of peace. And maximum pressure includes financial pressure, and Canada is announcing today several measures, sanctions, first and foremost, against a number of individuals in Russia, against over 40 entities in Russia and beyond that are trying to contribute to the evasion of sanctions, the sanctioning of over 200 vessels in the shadow fleet that Russia is using, again, to try to evade these sanctions. That's the first thing. The second is we are providing additional military assistance, drones, helicopters, broader munitions, over $2 billion worth of assistance directly to Ukraine. And thirdly, we are dispersing the next tranche of the loan based on the frozen Russian assets, over $2 billion as well. This is our contribution. We'll be working with our European and other allies for their contributions to provide the support. And to be absolutely clear, this support will be unwavering until we get a just peace for Ukraine and Ukrainian people.
Thanks so much, dear Prime Minister. First of all, good to be here in Canada, and for the G7 summit, thank you for your invitation. But first of all, thank you for your very important words, warm words and supporting Ukraine. Of course, condolences to our families. Really, Ukrainians had, our families had, very difficult night. One of the biggest attacks from the very beginning of this war, 440 Shaheeds, Iranian drones, and 32 missiles, including ballistic. And I was on direct connection during the flight with all the ministers and of course with the chief of air defense, and really it was a big attack on civilian infrastructure, on people, just people, houses and etc. And for now, information is not total information, not that final information, but for now we have 138 injured people and 12 killed. And so yes, it's a big tragedy for us, and we need support from our allies, and I'm here, and thank you for the military package. It's important for our soldiers to be strong at the battlefield, to stay strong out until Russia will be ready for the peace negotiations. We are ready for the peace negotiations, unconditional ceasefire. I think it's very important, but for this we need pressure. And of course I want to speak with Prime Minister today about sanctions, additional sanctions, and thanks for the real unwavering support from your side, from all the Canadians to our people. Thank you.
Thank you very much. Merci beaucoup. Thank you.
Thank you.
Actually, can you hold it? I can hold it.
Yeah, no, it would be very timely, very hard to us, because
No, the others are there. Okay, here. Bring the media out. He's doing a spray outside.
Okay, let's go.
I'm just going to go out. Yeah, so I'll stay here. They'll just go out.
Let's go. Bring it over. Out. Media right here, please.
Sorry, just get a shot of the TV. Yes, very quick shot of the table, guys. Okay, I'll give you about 30 seconds. 30 seconds for media and then we're out. Okay. Okay, that's it. Thank you. Media, thank you. Everyone. This way, please. Please, this way. This way, please. Okay, thanks, everyone.
Gary, do you have radio?
Is sunscreen on today?
Thomas? Wir müssen einfach nur auf eine andere Position gehen. Wir gehen aber von hier zu E4.
But that's why I was waiting just here and he left me he may turn over turn off. Or if there is somebody. I'll let you know tomorrow. How about that?
Great. Gary said 30 seconds, but good market.
And remain seated. Hello. Are you gonna all remain seated or? He's like just behind.
No, it's just the
Right after the family photo, gonna grab you and Amber right after the video.
Open that up, what you mean?
Mark Carney, Prime Minister of Canada. Le très honorable Mark Carney, Premier ministre du Canada. Mr. Ajay Banga, President of the World Bank Group. Monsieur Ajay Banga, Président du groupe de la Banque mondiale. His Excellency Antonio Guterres, Secretary General of the United Nations. Son Excellence, M. Antonio Guterres, secrétaire général de l'Organisation des Nations Unies. Honorable Anthony Albanese, Prime Minister of Australia. L'Honorable Anthony Albanese, Premier ministre de l'Australie.
You don't want to.
Honorable Narendra Modi, Prime Minister of India. L'Honorable Narendra Modi, Premier ministre de l'Inde. Excellency Lee Jae-myung, President of the Republic of Korea. Son Excellence, Monsieur Lee Jae-myung, Président de la République de Corée. Excellency Claudia Sheinbaum Pardo, President of the United Mexican States. Son Excellence, Madame Claudia Sheinbaum Pardo, Présidente des États-Unis du Mexique. His Excellency Luis Inácio Lula da Silva, President of the Federative Republic of Brazil. Son Excellence, Monsieur Luis Inácio Lula da Silva, Président de la République fédérative du Brésil. His Excellency Cyril Ramaphosa, President of the Republic of South Africa. Son Excellence, Monsieur Cyril Ramaphosa, Président de la République sud-africaine.
Prime Minister, President of the world. I promised you one minute, I promised you the President of the weather. I'll see whether in the excellent. Very good. Very good. Okay. Sorry to keep a bit of a delay, but we're not going to president. So it'll be a little bit Raro acontecer. Isso aí é, meu Deus, isso aí agora foi no carro que é muito. Os caras vão pôr o ponto, botou o carro embaixo. O cara falou assim, eu vou demorar 2 horas e meia. Eu provo 99%. O carro foi mais alto. Já fui 40 minutos. Procurei não foi nada. Falou, foi o vídeo que foi lá. Esse cara, liga pra ele. Falou. Rafa. Oi. Oi. A água aí vai bater na tinta aí no cabelo, hein? Não, porque eu continuo na foto oficial, né? Ainda não. Foto de família, né? Vai bater a laje aí. Short family program on the plane.
Then you can have like a clump to kind of peel off, right?
Watch yourself.
It does. For the moment.
Door faz a frente do mundo.
Olá. All right, both the cameras. Let's look happy with this. Second. Okay, start on the left. Start on the left, yeah. Lula, you focus. All right, thank you very much. Very good. Thank you. Wait there. You stay here. 07. Wait, 07.
All officials on this side of the room, please, behind that table. All officials on this side of the room, please. Thank you.
Wait, that's not enough yet. No officials back here.
No, all officials on this side, please.
This one here, please. Okay. Get your back over there. Good.
Good afternoon, colleagues. Bon après-midi, chers collègues. Monsieur le Président, je parle sur votre control. I'd like to welcome everyone here to the most important session of these 2 days here in Diagnostics. As many know, this... On attend. We wait for 1 minute for the translation, though. Because every word I'm going to say is gold. It's all priceless. According to me, of course. Alors, ça marche?
This is work now.
Does that work? Can I go? Yeah. Okay. Is it? Yeah. So, no, I mean, I don't want to say it is Bosch. It's. Does that work? Are we working now with the translation or the sound, Mr. President?
The sound is very low for Portuguese.
Yeah. Yeah, Antonio. This is all part of Europe's leadership. The president will be here by the time. Okay. All right. If we switch. Apologies, Mr. President. Okay, very good. All right. I'll re-begin. Je vais recommencer.
Let me try to begin. I thought we were beginning already. This is the most important session of our 2 days in the 2 days of the G7, because we now have with us
the chef de COP,
the
COP 30 de Brésil. Merci d'être venu.
Thank you very much for being here.
G20,
the head of the G20,
l'Afrique du Sud,
South Africa,
le chef de la Banque mondiale,
the head of the World Bank,
le chef des Nations Unies,
the boss of the United Nations,
le pays le plus grand du monde,
the biggest country in the world,
et le chef de file dans l'information informatique,
and the leader in
leaders
computers
in
and
so many
information
aspects from Australia, partners in security, partners of the G7, partners in the future of energy and beyond. We have a very important agenda together, but it's a sign of the maturity, I think, of the G7 that we come together for common problems in energy security, common opportunities in new technologies from information technologies, artificial intelligence, quantum computing, the need to have reliable supplies, that this table can produce reliable supplies in critical minerals for the future, and ways to find partnership for true development and, under your control, President Lula, sustainable development and how we'll work together. So thank you for coming to Canada. Thank you for coming to this G7. Canada is your partner in all these aspects, and we're all stronger together. So on a beaucoup à faire. We have lots to do. So I thank you, the members of the media, for your presence and for your amplification of the progress that we're going to make together. And with that, we're going to get to work. Alors, merci beaucoup. Thank you, everyone.
be ready? Very good. May I say, Excellency Prime Minister, it's a great honor to host you at the G7. India has been coming to the G7, I believe, since 2018 in Biarritz with our French partners, and it's a testament to the importance of your country, to your leadership, and to the importance of the issues that we look to tackle together, from energy security, from the energy transition that you're helping to lead, to the future of artificial intelligence, to the fight that we have against transnational repression, against terrorism, against other factors, and the work that we can do together. And it is my great honor to have you here. I enjoyed your intervention just now, and we look forward to our discussion.
एक्सेलेंसी, मैं आपका बहुत बहुत आभारी हूँ कि आपने G7 में भारत को निमंत्रित किया, और मेरा भी सौभाग्य है कि मुझे 2015 के बाद फिर से एक बार कनाडा की धरती पर आकर के कनाडा के लोगों के साथ जुड़ने का एक अवसर मिला है। भारत दुनिया की सबसे बड़ा लोकतांत्रिक देश है। पिछले दिनों G20 समिट की अध्यक्षता के रूप में भारत ने विश्व के लिए अनेक उपकारक ऐसे इनिशिएटिव लिए हैं। आज G7 के अंदर G20 में भारत ने जो मजबूत नींव रखी है, उसको एक प्रकार से नए स्वरूप में G7 में उसके एग्जीक्यूशन की दिशा में ले जाने में एक बहुत बड़ा अवसर है, और भारत इस अवसर का उपयोग ग्लोबल गुड के लिए करने के लिए हमेशा इच्छुक रहा है, आगे भी इच्छुक रहेगा। भारत और कनाडा के संबंध अनेक प्रकार से बहुत ही महत्वपूर्ण है। कनाडा की अनेक कंपनियों का भारत में निवेश है। भारत के लोगों का भी कनाडा की धरती पर बहुत बड़ा निवेश है। लोकतांत्रिक मूल्यों को समर्पित कनाडा और भारत मिलकर के लोकतंत्र को मजबूत करना होगा, मानवता को मजबूत करना होगा, हमारे रिसोर्सेज का ऑप्टिमम यूटिलाइजेशन कर करके मानव जात के कल्याण के काम में कैसे ला सकते हैं, उस दिशा में हम प्रयास करते रहेंगे। और मुझे विश्वास है कि प्रधानमंत्री जी के चुनाव के बाद मुझे पहली बार मिलने का मौका मिला है, तो इस चुनाव के भव्य विजय के लिए भी मैं उनको बधाई देता हूं, और आने वाले कालखंड में उनके साथ भारत और कनाडा मिल करके अनेक क्षेत्रों में प्रगति करेंगे। बहुत बहुत धन्यवाद।
Excellency, thank you for inviting me to attend the G7 summit. And I am very happy to get this opportunity to come and visit the soil of Canada after 2015 and to be in touch with the people of Canada. India is the largest democracy in the world. During our chair of the G20 summit, we took many initiatives for the welfare of the world. And today, we are extending that resolve through the G7 summit and going to execute it through the help of this platform as well. So I think that this is a great opportunity for us to serve public good, the global goods. It has always been India's intention to promote global goods, and today through G7 we have that same opportunity. I believe that India-Canada relations are extremely important, and India and Canada should work together and achieve win-win cooperation in several areas. Canadian companies have invested in India in a big way. Indian people have also invested in Canada in a big way. We both stand for democratic values. Together, we can strengthen democratic values. We can strengthen humanity. If we work together, optimally utilize all our resources, we can work for the welfare of the entire humanity. And I'm extremely confident that we'll be able to do this task. Excellency, congratulations on a grand victory on this election, and I'm sure under your leadership we will be able to work together in a positive way and take India-Canada relationship forward.
Thank you very much. Thank you very much, everyone. Thank you. Please.